Have a good day.
Every refuge has its So she tells him she must go out for the evening. You were when I walked into your house. I never want to leave. Sometimes I'm strong, cold and scared. Sometimes I'm wrong. But that time I saw you, you were due to light my night. Somehow I get by. Lovers forever, face to face. My city on mountain, stay with me, stay. I need you to love me, I need you, babe. Give me your love, take from me my name. Lovers forever, face to face. My city on mountain, stay with me, stay. I need you to love me, I need you today. Give me your love, take from me my name. Take from me my name.
Good morning, everybody. I'm just going to let you know that I'm having some difficulties getting one of our presenters on and a moderator. It will be starting shortly. I'm waiting for my backup moderator to get the notes so he can start. But I just want you guys to know we're not stalled and you guys are here. We are live. We are going to go with this. We're super excited for today. So just hold on and bear with me for a moment. I'm trying to get everything situated from one spot and everybody else is everywhere else. So
you are doing a great job, Tiffany. And Dr. DeRoyan is restarting her computer. I'm on the phone with her right now, and we will the Zoom box just as soon as we can.
Okay. Yes, just letting everybody know, please bear with us. Okay, can you guys hear me? What I'm gonna do is just go ahead and do a quick little, where's this slide at? Okay, welcome to our summit. These are our summit committee members, Dr. Deanne DeRoyne and Zach Palmami. They are our co-chairs. I'm Tiffany Lewis. I am the committee coordinator. We also have Olivia Mittal-Puamo, Dr. Elizabeth Berger, Janice Simon, Tandy Rennes, Maria Fairman, and Misty Slater. We all make up the planning committee. Normally, this is a 2-day in-person summit. However, with COVID and the way things are, being that we are a health group, we figured that it would just be a lot easier to go ahead and just host virtual. So that way we don't, become a super spreader event, because we do not want that. But I'm going to go ahead and just introduce Tim Rod. He's going to be our next presenter, and he is the chairman of the Iowa Tribe of Kansas and Nebraska. And I'm going to go ahead and stop sharing on my screen. We're going to let him share his screen and go ahead and start with the presentation. And as soon as Dr. DeRoyne joins us, then I can let her have her time. So Tim, you want to go ahead and start?
Yes, thank you, Tiffany. Everybody see everything? Is it up?
Yes, it's up.
Okay, all right. Good morning, everyone. First off, I want to take the time and this opportunity to thank the Planning Committee for the invitation, for me to have the opportunity to, share the Iowa Tribe story. We have a pretty important story, and what I tell people is, it's not about us. It's not about today, yesterday, or tomorrow. This is what we are building is long-term sustainability for future generations, hundreds of years from now. We've got to make sure that we fix these issues in agricultural today. So, we don't pass this off for the next generation to try to fix. So with all that being said, thank you, Planning Committee, for your guys' hard work and dedication to the Health Summit. My name is Tim Rod. I've been the chairman since 2010 of the Iowa Tribe of Kansas, Nebraska. Previously, I did serve a 3-year term as a secretary from 2007 and 2010. And I've always been a part of our agricultural operation in one fashion or another. Very passionate with what the work that we're doing here, and a lot of the work and a lot of the pat on the backs has to go to our staff and the farming employees, because those are the ones that are embracing this change for future generations. So hats off to all the staff for their hard work on the groundwork, because that's where all these changes are being made. So with that being said, I want to go ahead and start the presentation here. Again, it's the Iowa Tribe of Kansas, Nebraska, and we're returning to traditional farming and indigenous regenerative agriculture for a whole ecosystem approach. So what our staff does, and we've, the biggest thing that we had to do is we had to educate ourselves, not only the leadership, the executive committee and the membership, we also had to educate, our farmhands. And these are the 6 soil health principles that each one of those employees follow every day. So know your context, with our soil health practices are a reflection of ourselves and our stewardship of the land. And, we as Native Americans, it's important that we take care of the land that we do have, because this is all we have, with the Iowa Tribe, having this reservation that was set up many, many years ago. That's all we have. So we've got to protect not only our land, but our air and our water. So, cover the soil. Mother Nature was not intended to be, bare and uncovered and through monocultures. You know, the less disturbance in nature, you know, because if we think years ago, there was no mechanical or chemical disturbance across the land. So number 3 is minimize the soil disturbance. What we call it armor on the soil, or the skin. You know, that's Mother Earth that we're protecting, and it's just like our skin. Our skin is a protection for what is inside our bodies. So we've got to make sure that we always keep our land covered with a healthy living root 24/7. Increase diversity. You know, that's one of my favorite ones. Diversity is one of my favorite words, because the more diversity that we are, you know, the more opportunities that we're going to have and lay out in front of us. So mix it up with a diversity of plants and microbes and insects and wildlife and livestock. You know, Mother Nature did not grow monocultures. So, you know, I asked the question, why are we? You know, so that leads us into number 5, which is keeping a living root 24/7 as long as possible each year. And this is really important, because what we walk on is the land, and what is beneath and inside the soil is a healthy, living, functioning microorganisms that have to work together in a symbiotic relationship to provide all those nutrients to the living plant. So with keeping a root in 24/7, 365 days a year, those roots are going to feed the biology that lives within that soil. Last is integrate livestock. You know, grazing has been one of the essential components of all soils at one time or another. You know, we think back hundreds of years ago when the bison and all the wildlife had you know, grazed Mother Nature. So currently we are transitioning from a monoculture cropping system into a regenerative agriculture farming system. Monoculture, you know, in the past 15, 20 years, we've been heavily growing corn and soybeans. You know, we've been doing a lot of tillage. You know, we've been focusing and chasing the yields, you know, and that is where we've made a mistake as producers, is trying to chase that yield, because it takes so many nutrients to add synthetics to get to that high yield. The heavy use of pesticides and herbicides and synthetic fertilizers, this is the big problem that we have in our agriculture today. You know, there was a point in my time where we were waking up and we were trying to figure out what we were going to kill today. Was it a pest? Was it a weed? You know, and that's not who we are as Native Americans. And a lot of these synthetics, the herbicides and all those pesticides and fungicides is what is causing the soil degradation that we're experiencing today. Lack of biodiversity in a cropping system. We, like I said before, we've grown corn and soy. So we have lacked the biodiversity in our cropping system. Soil erosion, minimum water infiltration, with the heavy tillage and the heavy use of those synthetics has degraded our soil system. And we are not able to infiltrate water as we should. And, you know, a lot of the water is, you know, running off into the ditches and creeks and streams and into the river. And a lot of those nutrients that the land holds is being washed away. And the lack of soil microbiology. When I first started, I can remember being out in the field and there was no microbiology that I seen out there. You know, currently today we have earthworms back on our farm. We have all sorts of different insects that are coming back, and these are the beneficial insects. And that is our whole mission, is to build a house and a home for all these living beneficial predators that we have that can take care of the pest. So what we've done is we're transitioning into a polyculture with cover crops. That way So what we'll do is, like when we grow corn, we'll go in and plant the corn and into standing rye. And, keep in mind that standing rye is about 6.5 foot long. If you see in the bottom picture, the tractor there, the attachment on the back, the blue device there is called a roller crimper. So prior to this picture, what you would have seen is a 6.5 foot standing rye plant across the whole field. What we did is we planted corn and soybeans right into that directly. We come in a few days later and we roller crimp that to terminate the rye plant. And what you see is it's no different than what we do at home in our flower beds and in our gardens. That's the layer, that's the skin, the armor on the soil surface that we are, laying down. And what's going to happen is that is going to suppress the weeds. We suppress the weeds. We don't have to come in with a herbicide and a burn down. We're bringing a lot of beneficial insects back, and this is the home that they provide. And I've been out across our farm, and just the wildlife and everything is just flourishing. And from the earthworms to what I've noticed in the last couple of years is we've got a large flock of cattle birds that stay with our herd. And they help with fly control and stuff like that. So low to zero soil disturbance. We actually do not do any tillage anymore. We use tillage as a tool when we need to. Soil and an ecosystem of health focus. What I've always said is, I'll give this as an analogy, but what we're doing in agriculture is actually causing trouble in our health. And that's where we're seeing a lot of the diseases that we as Native Americans are experiencing. Profitability through diversification. This is important because we cannot go down this model if it is not a profitable enterprise. So what we've done is the field there on your lower left, that was in soybeans. We went with an organic seed. And that soybean crop will be harvested in the next few weeks. We'll take that seed, we'll clean it, all the fines and all that we receive from that seed cleaning will go into food source for our chickens. And through COVID-19, eggs were very hard to find. So what we did is we built some mobile chicken coops. They're basically just an old livestock tractor or a trailer that we developed that we pull across the land behind the cattle. And we actually had, we outsourced our eggs right here with our little small convenience store. So during COVID, we've seen a lot of need for the food that we should be producing today. Diverse multi-species crop rotations with livestock. I'll get into this a little bit later on our adaptive grazing program. And like I said before, living roots year round, that's what feeds the biology. Regenerative agriculture and human health. So, through the different practices that I've explained to you guys before, land degradation, loss of nutrients in the field, those nutrients are not staying in place for the uptake that the plant needs. And micronutrient deficiencies, we as Native American and tribal communities are experiencing diabetes, high rates of diabetes, cancer rates, heart disease. And it is all about the way that our bodies are set up. Our bodies weren't made to be ingesting the food that we're actually ingesting today, because it's the lack of nutrients is not there. Regenerating soil health through microbiology, transitioning the food-based agricultural system versus the commodity-based strengthened sovereignty at the root. And I always say that a tribe is truly not sovereign until they're financially sovereign and also food sovereign. And that's where we're striving today, is to build a food system that our tribal members and the local communities have an access to healthy, nutrient-dense quality foods. Nutrient-dense foods and healthy diets are very critical for early childhood brain development. There's lots of research out there, and that's where we're going to make this big change, is if we can start educating our young ones and, show them and teach them the types of food that we should be eating and the foods that we should not. So soil gut connection, how a soil microbiome impacts our human health. So through all of the practices in a commodity crop system, we have applied a lot of different synthetics that has degraded the soil biology. So on our farms, we have, over the past few years, we've seen an increase in fungus, pesticides, all those issues that we're facing out there today. So, what has happened is the microbiome of the soil biology is being degraded by what we're applying to it. And the same thing, folks, is happening to us as human beings. The food that we're ingesting today, the synthetics, the processed foods, is why we are seeing a increase in those health issues that we're experiencing, diabetes, heart disease, and more importantly, the increase of cancer rates are climbing here within our reservation and within our membership. So it's very, very critical that we make this change. And, not only on the ag side of things, but also we need to take advantage of our health clinic and, find ways to incorporate these healthy foods into the hands and mouths of our patients. So macro and micronutrient dense foods, the food that we're eating today just isn't quality anymore. The impact of pesticides, herbicides on gut and respiratory health. I've kind of already explained all of that. The diversity of microbiology in both soil and human biomes has a direct impact on our immune system. So what we're doing is, we're the root of what the cause is here. So healthy soils for a healthy life. I always say healthy, it starts with the soil. Healthy soil equals a healthy plant. A healthy plant goes to healthy animals, and those animals are our protein source. So if we can fix our land and add these different new practices and just create a new environment here within our reservation, and the biggest thing that we're trying to build is the access to the quality foods. This is pretty important here, protecting our water. I was with a tribal member the other day, and he had mentioned, he said, I scratch my head when I drive around some of your farms. And I said, well, why is that? And he said, well, I just don't understand your philosophy. I said, well, what do you think that philosophy is? And, he didn't really say, and he said, well, it's the bottom line. And I told this tribal member, I said, that is exactly the issues that we're facing today is all the local producers here in within our reservation are focused on that yield, and they're not looking at the bottom dollar. I told this tribal member, I said, why I'm kind of scratching my head at you myself, because I don't understand why you guys keep adding all of the synthetics, those nutrients, because our soil structure does have those plant available nutrients already lying in that soil. So, I told him, there'll be a point in day when every ag producer in this world will have plenty of dollars. But what good are those dollars if we have no water? Because without water means no life. Protecting our rivers by reducing invasive species through natural fish fertilizer. So years ago, one of the indigenous practices was we used fish for fertilizer for planting. So what we're going to do is our Fish and Wildlife Officer will be on the river The Missouri River just borders the kind of northeast boundaries of the reservation. And there's an invasive species called the Asian carp, the flying carp, or the big-headed carp. I'm not sure if everybody knows what those are, but they're overcrowding the river. So what we're going to do is we're going to go take those fish and we will turn those into a natural fish fertilizer. And we will not only use that for our vegetables, we're going to take that over our entire row crop operation as well. So the river's right to be free from pollution, just as we are. So we've got to pay attention to what we're adding to our land and in the air and what ultimately ends up in the water and in our food. So our adaptive grazing program, Iowa grass-fed pasture-raised Angus beef cattle. So it's been many, many years ago, previous leadership had taken a loan for our bingo parlor to purchase 13 Black Angus heifers. We're currently up to about 180 Black Angus herd, and we actually in the past have been a cow-calf operation. So we would raise the calves and then take those to market. Currently, we're transitioned into taking those animals to processing. So the adaptive grazing program, this is where I talk about, when the bison and the buffalo and all the wildlife had crossed Mother Nature and grazed, across those lands. So what we've done is we've transitioned into adaptive grazing. So what we do, the guys are actually going out, they're taking measurements of how much biomass is out there, feed for the cattle. And what we'll do is figure out how much forage is out there for how many days. And we actually go out and we set up paddocks. We build the paddocks on the measurements that the guys take. So if one paddock is there and we've got 2 days of grazing, the guys will go out and move after that second day into the next paddock. And that's what we're doing is mimicking Mother Nature as the bisons had moved through all these lands years ago. Learning from Mother Nature. Mimicking the great bison herds that grazed across the prairies and created these lands. That's exactly what we're trying to do and recreate. And then we're super excited. We just applied for a value-added producer grant through USDA. We were awarded that grant. It's a $250,000 grant that will be assisting us in taking our cattle to a further market. So that leads me into our direct marketing program that we're setting up. So the Iowa Tribe of Kansas-Nebraska is actually located right in the central United States. So what we've done is we've looked out 2 hours out and looked at markets. And so we're talking, you've got Lincoln, Nebraska, Omaha, Nebraska, St. Joe, Missouri. You got Lawrence, Kansas, St. Joseph, Missouri, Kansas City, Leavenworth, Manhattan. So our direct marketing program will be set up to not only have quality meat directed to our tribal members, we'll be going out and delivering to a 2-hour radius. We'll actually have drop-off zones in each one of those cities to meet the customers. So we cut out everybody else, all the middlemen are no longer involved. We're taking, this product, we're growing it all the way through and taking it to the end user. And that's what today's society is demanding is nutrient dense quality food. Indigenous agriculture, teaching the next generations. This is where we're going to make the big change. And the big change was very hard for me over the last 8 years when we went down this approach. Because we are smack dab in the Midwest, where right in the middle of corn and soybeans, and every other producer around us is in a monoculture cropping system. So the journey has been a rocky road, but the end result is going to be very rewarding once we have access to this food. So the biggest change that that, well, what allowed us to make the biggest change was education. You know, we had the number one, we had to educate ourselves. You know, but the biggest change is going to be right here with our youth. And that's where you see in the bottom left or bottom right corner there, we have tribal member Elder Pete Fee. And we have our Boys and Girls Club and some of the tribal members there that you see as well. And, you know, that was pretty gratifying. I was a part of this presentation, and, you know, to see P Feet there to, you know, to share those old stories and those old teachings and you know, some native words and language that revolved around, you know, food and corn and those types of things. So it's that's where the biggest change is going to be made. I foresee is right with our youth, because those are our next generations, and we've got to invest into them so they can continue to carry on what we're building. Food sovereignty includes a diversified agriculture enterprise. We are very diversified. We're doing corn, soybeans. We're doing wheat, triticale. We're doing barley, oats. We actually have a small herd of meat goats that we'll be marketing as well. We also have about 80 chickens. You know, we are producing eggs and distributing eggs right here, not only out of our gas station to the community, but we're actually incorporating all these food products into the casino, our tribal elder meal site program, and our daycare. So, you know, that's where it's important to me, you know, because we've got to start incorporating this good food to our, not only our businesses, but to the membership as well. You know, so in the last probably year, we are networking with other tribes. And what I am striving to do is establish old trade routes. Could be, you know, due to the fact that the Iowa tribe cannot grow every food product that we need. So if we can work with other tribes, establish those old trade routes, and we can bring also different sources of other food to our reservation, to the members, and to our community. So it's going to be pretty important, you know, to strengthen this over the next few years. And it's going to be pretty rewarding once it's all set up. And I think that was very, very quick. I went through that probably, well, 5 minutes to spare. So, you know, folks, it's knowing knowing where you're at and what you're trying to do. And, you know, we are not like every other farmer, you know, growing these crops for the dollars. I mean, that's one side of it, but the other is, you know, making sure that we can provide that food to our membership, and that's ultimately going to decrease our health disparities that we're facing today in Native Indian country. So with all that being said, is there any questions?
You guys can put your questions in the chat box, or if you just want to unmute, you can unmute and ask the questions yourself. It doesn't matter.
Good morning. I have a question. Thank you, Chairman Rod. This is Elizabeth Berger. That was a great presentation. You mentioned kind of in one of the early slides about one of the, I believe, a value added producer grant you had received. Do I have that right?
Yes. Yes.
Can you give a little more details about that, and sort of what advice you might have about being able to get grants to advance some of the goals of the tribe?
Yeah, you know, and that's when we started this whole journey. We were doing it all on ourselves, you know, with our own resources and our own dollars. and it's challenging to go down that route. So us being a Native American tribe, we have access to certain grants. So it was critical, for me to get this grant due to the fact that it was gonna spring us ahead much faster and get our products into the market much quicker. So it's a USDA program. I think it's just within the last 3 or 4 weeks, we were approved. And what that is going to do is, so we're transitioning from that cow-calf operation, and so it was challenging to try to, incur more expense through our operation. So this grant will assist us with, all of the marketing needs, for that new company. It'll pay for all of the processing and all of the packaging. So it's a 3-year grant. So we have 3 years to get through this process. So it was very important and critical for us financially to take advantage of these grants.
Thank you. And I just wanted to add a quick comment. That's such an important component. I've realized in my work working with producers across the state of Kansas is it's one thing to grow and produce, and then it's a whole other set of skills and expertise needed to market it. So that's really exciting. I can't be one of your first customers.
Yes, we are actually working with a consultant, which the grant will pay for. Taste Ideas is the name of that company, and it's pretty rewarding. This has been a big push for many years, and we're here now and doing it. So it's exciting. And keep in mind, this is just the start of the first direct marketing program, with our beef. We will have chicken, we'll have poultry, we'll have pork, and we'll have, all these other different types of different products that we can grow here. And that's where we've got things wrong over the years. And I personally got things wrong. I was just like every other producer around us. And, it seems like in the monoculture system and the commodity markets today and those cropping systems, producers, they're in competition. It's in competition with their neighbor. My neighbor is getting a new combine, so that's what I've got to do. And once we transition and we've found other producers that are going down the same path we are, it's not so much competitive anymore. It's more of how can we help and come together to fix these issues. And that's the biggest thing is surrounding people that have the same mindsets and same goals and objectives as you do. And once that happens, just use them as a resource, networking, because things that we're doing, they may have not ever thought about. So if we share those stories on what works, that will decrease those failures over time.
Chairman Rod, this is Deanne DeRoyne. Can you hear me?
I can.
Oh, yay.
Welcome. You made it.
Hanwei P.
Yeah, Hanwei P.
I apologize for the technical difficulties and not being able to properly introduce you this morning. We do have a couple questions, and then I have a couple more comments, but Janice Simon, whom you know from our Food Systems Project,
Yes.
is asking if it must be rye or can you use other grains?
We are using rye. That's the model that we're using, and that's what a lot of the other producers are using as well. And what the rye does is it gets up to the height that we need to have that biomass to suppress those weeds. They're possible. I mean, I've never tried any of that, Janice, but it could be possible. But you've got to keep in mind, whatever seed you are purchasing, you have to keep an idea of those costs on the purchase of those seeds. And what we have done is we're actually growing our own seed now for all of the cover crops. So about 4 years ago, we were purchasing all of the seed to do these practices. Now we're growing it on our own because we have the land base and we have the holding capacity for all of this. So we've cut that expense out and we're actually growing it now. And we're going to actually pivot and turn that into a cover crop facility, and we'll have a business started over the next few months that will be growing these cover crops, and we'll actually be selling those to other local producers. So, you know, we've cut an expense and we've created a business out of this. And that's kind of what we're doing across the whole board, is how can we add value to all of this and develop a product that is much better than what we have access to today. You know, one of the big things that I did not mention earlier is we've got greenhouses going up. We are currently working with Sweet Greens. We've got a contract with Sweet Greens. There are a large vegetable, or not vegetable, but leafy greens producer. So they're actually working with us now. Greenhouses should be up in the next 2 months. We'll start filling those up with seeds and get those growing. You know, our honeybee operation is flourishing, you know, and that was the biggest change for me, is when tribal member Pete Fee had brought the honeybee idea to me. And, you know, we sat down and, you know, I educated myself on how important those bees are into our environment, because you know, and over the years since we've had those bees, I've seen what we're doing in agriculture that is ultimately affecting those species. So yeah.
Chairman Rod, we have another question from a very exciting participant today, and that would be Christina Haswood, who is one, at my last count, I believe she and Ponkawi are the only Native legislators in the Kansas legislature. And she would like to know what the tribe is doing regarding climate mitigation, climate change mitigation.
So climate change, you know, climate change is interesting, you know, because a lot of people talk about climate change, but they don't talk about what is causing that. And the stuff that I've mentioned through here today, you know, with the anhydrous ammonia, we're putting anhydrous ammonia, that's nitrogen that the crop needs to grow. And we're putting that on, and what, by us not having that skin or that armor on the soil, you know, that anhydrous ammonia is either leaching down into the soil structure, which ultimately will get into our water source, or it will start evaporating. So we've launched in the last year, we have a Smart Farm initiative project that we're working on developing now. We're working with multiple companies to bring not only all of the technical equipment and all the data collection items that this equipment will have on it, but we're doing a lot of satellite imagery, and we're paying attention to the effects of the different practices that we're incorporating compared to other producers that don't have these practices instilled to them yet. So Smart Farm Initiative, we are working with John Deere, and we're also working with T-Mobile, and then we're also applied for some grant funding to increase our connectivity, wireless connectivity up here, because all this nice tech equipment and monitoring data is not going to work if we don't have the connectivity. So climate change is real, it's serious, and we, as not only as producers and Native American tribes, but United States citizens, need to educate ourselves on what is causing all of this. And it's a lot of it is the way we're farming.
Well, there are lots of positive comments for you, and we will get all of those to you. I'm not certain that there are any other questions. We still have about 6 minutes if anyone has a question. And while we're waiting to learn that, I would like to say that, is there a question?
There are a couple. So Sydney said, I'm very excited for the changes being made. Are there plans to expand the egg operation or bring back the buffalo?
Yes, thanks, Sydney. Yes, so we are going to expand our laying operation. We're looking at a new structure that will house 1,400 laying hens. And keep in mind, these laying hens will be in a structure that will be movable across our land. And You know, so eventually, over the next 6 months, we should have everything up and going for expansion of our egg production. We also have a new facility that's being built right now for all of the honey products and our egg production. So we'll have all of the equipment necessary to clean and package those eggs and get them out for distribution. Buffalo, yes, those will be back. I've got an interesting story from years ago, and I've been pretty ridiculed over the last few months with letting out that we're going to be returning those buffalo back home. So years ago, previous leaderships had a small herd, and you know, we didn't have the adequate fencing, and there was way too many bulls to cows. I think there was like 4 or 5 bulls and maybe a couple different cows. Well, we all know what happens when you get bulls in with not enough cows. You know, they get to fighting and arguing, and they finally got out, and it was just a madhouse here on the reservation because there was people on trucks and trying to capture these buffalo. So it's been rough, but you know, I try to educate them and let them know that we're going to do it, but we're going to do it in a much different way. And we're going to bring those buffalo home, and eventually we'll be setting those up as our direct marketing program as well. So yes, Sydney, egg production will be increased and the buffalo will return back home.
Okay, we have another question from Rebecca Jones. Much of the land within the reservation boundaries is farmed by non-members. Can you discuss how the tribe is working with the non-native farmers to get on the same page with us as far as the river rights and the other values you've discussed?
Yeah, that's a challenge, Rebecca. You know, our land over the years has been taken away from either the tribe or the membership in one way or another. You know, and our practices are not welcomed here by the local producers, which is really unfortunate because if they would just take the time and the opportunity to educate themselves on what the value of this change could bring to their operation. You know, so that's going to be a challenge over the next few years, you know, because we can fix our land, but we can't fix maybe somebody that butts up next to us. So what we have experienced over the number of years is I've always made it a goal to try to purchase as much land as we can back. But that's been pretty challenging when it gets into out of the tribe or tribe members' hands, because it usually goes to public auction, and those local farmers that have, you know, deep roots in inheritance money, you know, we can't compete with that. You know, so land value up here on the res is going for, you know, $12,000 to $13,000 an acre, and you can't make that work, not on paper. And that's where, you know, the biggest change that I realized came out of we were failing. You know, and about 3 years ago, the executive committee did have to make a pretty important decision, and they were leaning towards leasing out our land, you know, because it just wasn't work financially, you know, due to the fact that we can't keep purchasing these lands at these high rates when the markets aren't there to support that. You know, but that would have been the wrong decision to do, because once that land would have been leased, you know, we wouldn't have been able to make sure that all this change is happening today. So Rebecca, that's going to be very challenging, and the only way, you know, I've got some ideas, but that's a huge challenge here, you know, because we can make this change ourselves, but we can't force change upon other people. You know, I'd welcome any thoughts from the group, or Rebecca, if you guys have any ideas of how we can work with the producers. But, you know, it's been probably about 2.5 years. I did have Understanding Ag. They're one of our consultants here on our reservation. I had all the partners here, and we opened this up to the community, invited a lot of the local producers here, but none of them came. You know, they never gave the time to just come and learn to see if it was worth value or not. So it's going to be a struggle. For sure is.
Chairman Rod, our time is about up. And so I would like to just take a couple minutes to say that I think, especially the members, Sydney and Rebecca, who've commented, and all those who are observing, it takes a tremendous amount of courage and leadership to take the untraveled path. And we really honor you for the strength that you've shown, the leadership that you've shown. And I would just like to say that there's so many benefits to what you're doing. Some of them are obvious to us now, some of them we may expect, some of them we can't even anticipate. But just for example, not are you making the tribe more financially sovereign, but I can think of 2 families offhand who have children or grandchildren returning to the reservation because there are jobs for them, and bringing the families back, strengthening the families. So kudos to you. Thank you so much for presenting to us. And I have the feeling that we'll be asking you back.
Oh yeah, anytime, and this is just the tip of the iceberg. I didn't want to overload everything with everything that we're doing. And it has been a rocky road, Deanne. And those words are very important to hear to me because, I tend to focus on the negative sometimes. And, that seems like that's all you hear. So that's what you start believing. And, I keep pulling myself back out, and I keep, I focus on my kids and your kids and grandkids. That's what we're doing here today. It's not about us. And we've got to quit living for yesterday or today or tomorrow. We've got to start looking long-term. That's the only way we're going to be successful.
We appreciate your vision.
Thank you.
Wadikrodiki.
Okay.
That's it. Good day.
PK. Today is a good day.
Well, hopefully you will be replaced with Elizabeth, Dr. Elizabeth Berger here shortly.
I'm here, Dr. DeRoy. I don't know if you
Good.
wanted to transition us to the Resilience Community Panel.
Yes, I do. And I just want to make sure that everyone knows that you are one of our committee members, that you are also, I'm not sure what your official title is with the Sunflower Foundation, but we first met you when you were working on a trail on the Kickapoo Reservation, and you joined our group and have been steadfast ever since, and we certainly appreciate that. And please take it away.
Well, thank you very much for that kind introduction. I am a senior program officer at the Sunflower Foundation, which is a statewide health grant making entity, and it has been our honor and privilege to have worked with all of the tribes, and specifically with the Tribal Health Summit Planning Committee over the last 7 or 8 years. So first of all, before I sort of launch into our panel, and I know our panel members are all here because I checked, I want to make sure everyone can hear me okay. So Tiffany, can you give me a thumbs up to make sure my volume's okay?
Yes, I can hear you.
Great, thank you. All right, well, before this summit started, some of the slides with our speakers were going across the screen. So I'm hoping that everyone had a chance to look at those slides. They will also, I believe, be on the screen during lunch. So you can again see, I have to put on my old lady glasses here. We're so pleased to welcome back Chairman Tim Rod. He'll be joining us on the panel. Also, Vice Chair Zach Pomami will be joining us. Mr. Jacob Wamigo, the CEO of the Prairie Band Potawatomi LLC, and Sunny Beato with the Kickapoo Tribe, who is the enrollment coordinator and also on the school board for KNS. There they all are. Hello. I would stop right now and invite any of the panel members, if they want to say a little bit more about themselves and their role in the community. Actually, it might be easier if I put them on the spot. So since Tim just had to talk, I'm going to put Vice Chair Pomami on the spot and just have you spend 30 seconds introducing yourself to our audience.
All right, thank you, Elizabeth. Can everyone hear me?
Yes.
All right, good morning. Yes, as Elizabeth said, my name is Zach Pomami, and I'm the vice chair of the Prairie Bend Potawatomi. And I also serve as co-chair for the Health Summit Planning Committee. My involvement with the planning committee began in the very early days of when this organization, or the original concept of this organization came about from a grant or monies that were received through KDHE. And at the time I was working for another tribe and serving on their, as a representative for that particular tribe and helping to assess the needs of the tribal communities. And eventually I found my way back into tribal government as the vice chair for the Prairie Bend Potawatomi, and have served as both a committee member and now as a co-chair for the past few years. And I've enjoyed the work that I'm doing. It's allowed us to really assess the needs of tribal communities and get in touch with the needs, and also to plan for the future in terms of health and wellness, and providing community members with the information that they need to hopefully live a higher quality of life.
Thank you, Zach. That's perfect. I'm going to turn to Sunny Bowato next. And if you would like to share with us a little more information about yourself to those in the audience that don't know you, we'd appreciate that.
Hello, my name is Sunny Bowato. I am a community member of the Kickapoo tribe in Kansas. I am the enrollment director for our tribe. I am new in my career as a tribal worker and a tribal leader. I have a degree from Leech Lake Tribal College in Indigenous Leadership, and I'm working on another degree from the University of Minnesota in Tribal Administration and Governance. So I'm fairly young, and this is my first year working with my tribe. I have held various formal and informal roles with my tribe and community. In the last year, I have held the position with the Kickapoo Nation School Board as a board member and secretary. I also am learning to grow foods and medicines in our community, and I work with our community garden, and I just recently moved back to my community in the last year, so I'm just becoming acclimated with working with my community after living in another Native community for the past few years. So that's all I have to say. Thank you.
That's great. And I think we can all agree that is one of the most beautiful photos we have ever seen. That is absolutely breathtaking.
Thank you.
Mr. Wamigo, I'm sorry you have to follow up looking at that beautiful photo, but yours is pretty good too. So if you'd like to take just 30 seconds to tell us a little bit more about yourself, that would be wonderful.
Sure. Can you hear me all right?
We
Yes.
can.
All right, great. So as I was said, my name is Jacob Omigo. Most the community knows me by Tug. I'm the president and CEO of Prairie Bend LLC. I live here on the reservation at Prairie Bend. I'm a tribal citizen. Not quite sure why they asked me to be a part of this panel, because I'm not that familiar with the Tribal Health Summit. I know we've sponsored it a few times, but I know it's about resiliency, so I'm sure it's probably coming from more of a business perspective. But my responsibility is the chief executive of Prairie Bend LLC, which is the non-gaming entity owned by Prairie Bend Potawatomi Nation. The pandemic has definitely challenged all of us, and I'm just happy I could be a part of the event here today and hopefully share a few things with the group. I know that a lot of you have worked hard on this summit, and unfortunately we couldn't be together in person, but hopefully in the future we could all gather again. But I appreciate the invite, and hopefully I have something to add to the conversation. Thank you.
I know you definitely will. Thank you all four of our speakers whom we know have busy lives. And I was thinking about amongst you, you really represent 5 important sectors that we'll try to touch on today when we think about resilience during the age of COVID, especially. And that would be local government, education and school, business and economic development. And then each of you in some way, you're part of a family and you're also part of your community. So you all bring to the table some perspective that I think we're all eager to hear and share. And when I say we, hopefully we're going to have some questions from the audience. And Olivia has offered to be my co-writer in this, and she will be checking the chat box and has full liberty to interrupt me anytime to say, hey, Elizabeth, we've got a question in the chat box that you may have missed with your old lady reading glasses. So let's take it away. And let's start with local tribal government. So this question is directed to both Vice Chair Pomami and Chairman Rod. Just thinking about the last 18 months and everything that has happened, just share with us your reflections, thoughts, feelings, experience as a tribal leader and some of the decisions you had to make. And I'll pause here and let one of you first.
Go ahead, Zach. I'll let you go ahead and take this one. I'll follow it up.
Okay. Essentially in this last 18 months, I think, like many of the challenges that tribes have faced throughout our history, this is going to be another a learning experience, I say, essentially, for a lot of tribes in the globe. This is something that we've never dealt with in our lifetimes. I believe the last pandemic occurred in 1918, and the world dealt with that. So we have very few that we can rely on for that knowledge base, as we often do in tribal communities. We rely on the knowledge from our elders, but unfortunately, we don't have a lot of people around that may have lived through that particular time in life. But I think Native communities' ability to adapt to change and the challenges that we faced throughout our history has served us well in this past 18 months. I'd say for the Prairie Band Potawatomi, we've had a tremendous spirit of cooperation that not only existed in tribal government, but ultimately, in order for us to come through this event in a way that minimized the impact on our communities, ultimately the community had to get involved and become aware. And a lot of that was a give and take, exchange of knowledge between tribal administration and relaying information of how to maintain their own safety, maintain the safety of their families, in order for us to move forward and come out of this in a less impacted way. So I don't know if that's too general or if you would like me to speak more specifically.
I think that's great. And Chairman Rod, if you'd like to follow up with some thoughts. You might be on mute.
Thank you, Elizabeth. Yeah, so it was rough. It was challenging. It was a struggle. And to be honest with you, I didn't like Zach said, how can you prepare for something like this? You really can't. So what I feel how we made it through was, that we have the dedicated staff, not only at our clinic, but we have a dedicated executive committee that, we work through it. We put our heads together. We came together as a team, and, that's how we rose above and were able to get the things done that we needed to get done. And a lot of it goes to the staff, the on the ground workers that are there, boots on the ground doing all the work. And, one of the biggest scares for me during COVID was, if our health clinic had ever had to shut down due to the staff, getting the virus. And, I didn't know what we were going to do. But luckily, we implemented several different strategies, and we met with all the department heads, and and made sure that they had a clear understanding of what it was going to take to get us all through this as a tribe. So a lot of it, hands down goes to the ground workers, the forefront leaders there within our clinic walls and across the whole tribal complex, the businesses and everything. It was definitely rough. We had to shut our casino down, for a few months. And, with us being a small tribe with a large membership and having a casino in the middle of a cornfield, financially, it was scary. But we came together, we persevered, and we made it. And we will continue to do that each day from here on out. And we'll just take it by the horns and do what we can to get through the struggles that we have here on our reservation. So a lot of it just goes to the staff. I can't thank them enough for all their hard work, and because it was a little unsafe for some of those with what they were doing. But it's coming together. Strength comes in numbers, and putting a plan in place that's really all we can really do.
Wonderful, thank you. You mentioned the casino, and that's a nice segue into, I realized the Prairie Band LLC is the non-casino part of economic development, but for Mr. Wamigo, COVID just sort of wreaked havoc on businesses everywhere, safety of workers, safety of employees, safety of customers. I'm interested in what sort of things did you and your team have to think about and are still thinking about in terms of the business entities and how to keep those going and the jobs there?
Yeah, so it's been definitely a tough 18 months. Our first, I have to give a shout out to our tribal government leadership. They really set the tone for us. Okay, we're gonna get these safety measures into place. We're gonna, really kind of shut things down, take a look at what's going on here, because we weren't necessarily prepared. The actual business operation or disruption was very minimum for our companies as far as being shut down. At the very beginning, we took safety measures, putting up shields, putting up, mandating masks as the tribal government required. And, our first concern was our employees, to make sure they were healthy. We don't have a healthy staff, then we can't operate. And if people are out sick with COVID, or they're worse than that, then it's not a good thing for the company. So we wanted to make sure we took care of our people. And then secondarily, we had to look at our customers. They were adapting as well. One of our primary customers is the federal government, and it's pretty much been shut down as far as agency, visits and site visits. So everybody's kind of adjusting to this, right? Zoom meetings or Teams meetings or whatever. So we had to pivot from our normal business development efforts of going to a military base or an office in the city, and sitting down with a contracting officer and telling them our story, telling them why we're the premier provider of whatever we provide, whatever service or product. It's all transition, and it's really been challenging for our team. It kind of has slowed some of our growth down, because we're kind of in a mid phase where we're not quite, have this whole robust government contracting division going, but it's going pretty well. We're still at that just kind of tip of it, where it's getting ready to take off again. So it's definitely been a challenge, and I have to take my hat off to my operations team. They developed a mitigation strategy that we implemented, our board reviewed, and we've had very good success keeping our employees healthy, safe. I'm not saying we didn't have any infection or some missed work days, but we done best we could with the resources we've had. We took advantage of some of the programs that were out there by the federal government, have PPE, getting that to our folks, and following what the tribal government did. They provided resources for us, and the government invited us to their weekly kind of team call where okay, this is what's going on with COVID. This is infection rate. Here's this gathering all this data so everybody's informed. I have to say the communication during all this has been pretty good, and it's kind of broken up some of the silos that exist within tribes at times where you have your tribal government, they have their institutional knowledge, they have all their roles, and if there's a gaming facility or whatever else is set up, they have their circle, they keep all their information. And if for some reason you have an economic development company like Prairie Bend LLC, then they have their own little thing too that kind of takes pieces of both. But we've done a really good job in the past 18 months of coming together as a whole team and really making us a team effort. Is probably so resilience. I think we've all shown it during this pandemic. It's really challenged everybody, but for the most part, I think our community has risen to that challenge.
Great, thank you very much. So local government, business, let's think now about education. This has probably been one of the most challenging years most people, whether they're teachers, superintendents, or on school boards, can remember. And I'm going to direct this question to Ms. Bowato first, but then Mr. Wamigo, if you as a former school board member have anything to add, feel free to jump in at the end. So Sonny, I think you said you moved back recently and you jumped right in, you're on the school board. Oh my goodness, what a year to start in that role. Share with us just some of your thoughts and reflections from the past year.
Yes, so in my formal role as the enrollment director for the tribe, I have learned, well, one of my roles is managing our burial funds. And with that, as learning to be a part of my home community again, we learned that we have funding for, some funding for burials, and we lost, at the end of last year, we lost one tribal member a week for the last 12 weeks of 2020. And that's a lot, as we only have around 1,500 tribal members. So with that, we had to hold space for a lot of our community members who were losing people in their families. And then as a regular community member outside of my role, I had to learn how to help families with those parts of burial services and funeral services that are outside of the scope of funding, where we need certain items and things like that to help the families. So I think with all of the loss that we experienced as a community, it affected everyone. Something that would fit, or something that would affect one community member affects all of us as a whole. And I'd say we had to learn, everyone had to learn how to be closer and learn how to be, I guess, just a better community member, or a person that can hold space for each other.
So I'm going to follow up with a question I didn't expect to ask, but so it sounds like in your role as enrollment coordinator and managing the burial funds, you had to work with each family that lost a family member. How did you personally find strength? That sounds immensely difficult.
And I haven't had to work with death so much before, and I think myself as a person, I had to learn that I had to use everything I had to keep being present for my community, and it really changed me. It took me a lot of time to process all of the deaths that we had in our community. And we had triple the amount of deaths last year than any of the previous years on average.
Well, thank you very much for sharing that with us. We'll pause and let you take a break for a moment. And to Mr. Wamigo or the others in thinking about Chairman Rod had mentioned in his presentation, it's about the youth. That's who we need to keep going. So any thoughts or reflections on what schools had to do, especially those with children that were tribal members, sort of the challenges they underwent and how they responded to that?
Well, I can talk from a school board perspective a little bit. Like it kind of sucked that my first year on a school board was right at the beginning of a pandemic. And so the second month into being on the board, we had to shut the school down and finish the school year remotely. So, keeping our kids safe and keeping our staff safe was super important, and our district did a great job of doing that. And we actually found out that, we were worried about, everybody's this mask thing is still in the paper all the time, right? Or on the news, and everybody's one way or the other on it. We're really worried about the compliance of our young kids, and surprisingly, they were really, really good at being, wearing masks. And I'm really proud of our young kids, even my own kids. They can't get vaccinated yet, whether you believe in vaccines or not, but they can't get the vaccine yet. And so our school this year started out with, optional masks. First week, the cases, like a lot of districts, just jumped up. First time everybody gathered in several months, and just a spike. And then so the masks were re-implemented. But I asked my daughter, so that first week, how is the mask thing going with the school being optional? She said, well, actually, she thought like 60-70% of the kids still had masks on, even though they weren't required. They didn't, the rules didn't make them, but they were doing it anyway. And then the teachers were, there was a little discrepancy she felt between males and females. More females had the masks on than males, but there was still a high degree of people, following the guidelines, right? So our kids are great. I mean, I think they've dealt with this, at least from preventive measures, probably better than most adults. We'll kick and scream. We don't want to be controlled or whatever. But most of the time, our kids have done a great job, and I'm pretty proud of them. And even my daughter, she was actually had COVID earlier this year, and unfortunately she didn't get very super sick, but still it was concerning. I mean, it was a scary time. What's going to happen? Are you going to be one of the few that gets is in the hospital or worse? And there's always that one case, and I think there's a lot of the unknown is kind of why we're where we are. People just don't know, and they don't trust. And unfortunately, right now, everybody's an expert, or we have social media, and everybody's an expert. Well, I read this, or so and so said that, and I'm like, well, there's people that have been studying this stuff all their life, and they're pretty good at it. They know what's going on. I mean, they can't predict everything with certainty. There's nothing that's 100%, but we can do these measures. So I gotta say that our district has done very well. I think our community has done very well. So
Thank you for sharing that about your daughter. That kind of dovetails nicely into, I said at the beginning, all of you are part of a family unit in some form or fashion, whether parent, child, brother, sister, auntie, uncle. Mr. Wamigo, how did you find you had to wear different hats as in responding to COVID? Like, you can work with your team, business, whatever, and then boom, it suddenly happens in your own family. Did you have different coping strategies that you used for resilience in that?
I don't want to throw my hands up. No. Yeah, I mean, it's when you're leading a team and trying to, keep everybody, because it was really scary at the beginning. We had, a lot of issues. I mean, we had some issues with people just not knowing, and we did go remote for a bit, and then transitioning people back. People didn't feel comfortable, and some people were like, you have a diverse group of people that have their opinions about the virus and how serious it is. So it's trying to get a talk to those folks and get them, okay, here's what we're doing, and kind of pushing some of that off on the government, a little bit. So if there's some hesitancy, I can say, well, this is being mandated here, but we also believe in it as a company. That's an unfortunate thing about the school board. I'm sorry to go backtrack a little bit. The state didn't really help. They pushed everything down to the local and they pushed it to the superintendent. So I feel bad for a lot of the superintendents and school boards that had to make the decision. But so it was a lot of different hats for sure. And I had to quarantine several times. Unfortunately, I never did get infected, but it was close contact several times. And going from that, okay, I'm in the middle of this company that we're doing all these great things. We have, work all over the country in different states, different agencies, and the rules are different here, trying to make sure that everybody's staying safe. And so it definitely was a challenge as far as different hats, from being a parent to being a boss or something that's in charge of something, to be on the school board, and just being a community member that wants to know, well, what's going on, what are the different rules, and what's an infection rate and all that. So yeah, I don't know if I answered your question, but
You spelled that
I
out
ramble.
really well. No, it's making me think how all of us, both our panel members and everyone in the Zoom box here, during the last 18 months, I don't think I've ever worn so many different hats, like you said. Employee, family member, community member, and trying to constantly pivot. I do want to pause here in case anyone, I haven't seen any questions come through the chat box, but I want to make sure people know I'm going to pause for about 5 seconds in case anyone in the audience wants to pipe up with a question.
I have a question, Elizabeth. Can you hear me?
You bet, Julia. Great.
I'm outside. I was just wondering, I still have family members who are not convinced on getting the vaccine, and I was wondering what are your guys's ways of effectively getting that message out there about the vaccine and to overcome vaccine hesitancy. I don't know if you guys have had any success with that.
That's a great question, Julia.
If I may, can you hear me, Elizabeth?
Yep, we can.
We are having a session on that very topic this afternoon, Julia. Dr. Garcia is going to be here from the governor's office. She is in charge of vaccine equity, and she will be talking about how to help convince your family members and others to get the vaccine.
And Julia brings such a good point that I think when we think about resilience, it's not just in the face of these sort of logistical adversities and the sadness, but also in my own family, at least, a lot of tension and fractures based on how people believe about the seriousness of COVID or the validity of the vaccine. So I definitely don't want this question to be to probe you into sharing something you don't want to share, but in thinking about your roles as family members, maybe I'll direct this to Zach at this point. What can you just sort of reflect on your role as a family member and how that has changed, or what you've done to be strong for others, or they to be strong for you?
Well, I'd say as far as the vaccine goes, for me personally, what it really came down to is the fact that I'm a member of a community where many people are medically vulnerable, including some of my own family members. I really had to do some self-reflection and realize that it's not just about me as an individual. Taking the vaccine was really for my community, for my family. In the end, I really wasn't willing to take chances in terms of getting COVID versus some of the either misinformation or people lacking the facts of supposedly the side effects of the vaccine. So what it really boiled down to is I wasn't really willing to take the chance of getting COVID, and potentially passing on to family members or people in the community and endangering others.
Thank you for sharing that.
Hey, Elizabeth, I got a
Oh.
quick question for Sunny real quick. And this is, we've actually been struggling here at the Iowa Tribe, when the CARES Act dollars had came out, of trying to figure out what those dollars should be used for. So can you talk about how you and the Kickapoo Tribe was able to reach the membership? Because like for instance, we hired a tribal member to complete a needs assessment to figure out what needs are out there of all the tribal members. Once that assessment comes back, we'll start identifying those needs and prioritizing those, and then develop the programs off of that. But with 5,000 members within our tribe and only about 1,600 addresses, I felt, and I still feel, that it is very challenging to reach the membership to, find out what they need. So have you guys experienced any of those issues with communications with the members? And if so, how were you able to pivot and, address and communicate with those efficiently?
With the funding, we allocated money to our housing program. That's the biggest one I can think of, where we were able to help tribal members who experience loss of income, or any sort of loss during the pandemic, where they paid for their rent, utilities, and essential needs. That I know a lot of funding went there. My sister, she actually is, she's in this meeting as well. She is the education director, and she mentioned a lot of our students, they had trouble with housing themselves during the pandemic, and I think that's a gap that we need to still work on as a tribe. Our students did not have funding to pay for their housing while attending school, because of the schools they weren't in person, and there weren't options for them to live on campus, and so it was hard for our students that way. And that's something that we're working on now, because we have received more funding, and she's I think if she got on here also to mention that, Winona, do you want to mention a bit about?
I didn't mean to put you on the spot, but that is something that up here at the Iowa Tribe, we are experiencing, and we still are today, and this needs assessment isn't going to do any good for us if we can't get that assessment out to the members and get that returned in some fashion, so we're kind of caught, we don't know where to go from here. We want to put these dollars to good use, but we really don't know. I mean, we can set up all these programs, but how do we know that that's what the need is? So we're trying to figure out how to get our membership to comply and get this assessment in, to get that data back to us, so we can start putting together the programs that they need. It's been a challenge for us, because like I've said, we've got like 1,600 addresses out of the 5,000 members that we have. And it's just, we've tried to, recruit and obtain and get those addresses, but it's just not happening. So I didn't mean to put you on the spot, but if there's anybody else that may have experienced that difficulty, or, how did you guys transition to get through that?
And I'll add one thing is, our addresses are usually up to date, and that's because we receive per capita payments. So everyone usually gets their addresses in to receive their payments. We have some that don't, but that's one of the reasons why we have everyone's address up to date.
Okay, that explains a big difference there, because we're a non per capita tribe, so that explains most of it there. Thank you.
This is great back and forth. Rebecca Jones put in the chat box the consideration to incentivize the return of the needs assessment. And from her work, folks will do a lot for a t-shirt. So appreciate that, Rebecca. And others, if you have thoughts, please put them in the chat box. I think Chairman Rod, you bring up such a wonderful point. And I'll share very briefly, as philanthropy, we have struggled with this for the entire 18, 20 months of COVID, of where is the need greatest? And with so many funds flowing from so many different directions, especially the federal government, where can you find out where dollars will do the most, and what is it exactly that people need? And this takes us to kind of the last question, and well, the second to last question. And that is, and this is a free for all, whoever wants to jump in first. What do you believe would be most helpful to your community at this time in terms of COVID, whether it be relief funds, vaccination outreach, education? What would that be, that one thing?
Well, I would say not knowing how much longer we're going to be in this pandemic, and given the rates of vaccination, I would say probably relief funds, both for individuals and I think tribal governments, because what the pandemic has done for tribal governments is brought to light a lot of the inadequacies of our infrastructure, which we have known for decades. We've always had underserved, or our level of funding has always been less than our overall needs. So it's really brought to light the need to refocus our efforts on getting our communities back either connected through the internet, which relates to the education question earlier, and just in general, for people to be connected to the outside world in terms of business, living their daily lives, the needs for repairing roads, the facilities that we house our programs in, those types of things. I think, in my opinion, again, not knowing the prolonged nature of this pandemic, those would probably be some of the more immediate needs for our community.
Hi, I can't speak for my entire community, but what I can speak for is like the education portion, what my sister was saying, Sunny. A lot of our students, a lot of students lose housing because they were relying on housing that could be like family housing, that could be dormitories, those types of things. A lot of students became homeless because of that. And another thing is that they lost a lot of their funding because they went from in-person to online during the middle of the semester, and then like to distant learning that next semester and the semester after that. And so their grades plummeted. And because of that, they lost a lot of their scholarships. And like something I was working with a lot of my students is making sure they stay into school, and with that loss of like grade point average, that could halt them from going to school. And I think that's really, really something that we didn't see as a nation expect, but now, like, you know, we're trying to get our students right now, we're at the highest level of we've a capacity of students that we have enrolled this semester. We have 30 students enrolled in our higher education. So I think just being compassionate and understanding of how we can combat that, like with the grades and like the funding and all of those things, and how we as the tribe and as our departments can support the students and support their education goals during this pandemic, and like how we can provide things to take away those barriers. I think that's something that with that funding and getting those fundings, and so how we can combat that with for the students and at the schools, and how we could be there, that source of support, I guess. Yeah, that's the best word, when they're in school, so that we could talk to their professors, we could talk to the schools so they can continue their educational goals. I think that's something that is really hits hard for home for us in my department.
Thank you. I really appreciate you jumping that in. You give a great example of sort of the domino effect of how one thing happens and all this other. And I think we're all a little fatigued by the domino effect of the past 18 months of pandemic. we have just a few minutes left. And again, we are so grateful that all 4 of you joined us today. I'm going to, you can make this fairly brief. We'll go to Sunny first. The question is, after the past 18 months, how do you, and everyone's going to get the same question, so the last person has the advantage. No, how would you define resilience? What does it mean to you?
And I always like to look at things through a community viewpoint. Resilience is, I think, coming together and helping everyone on an individual basis have their needs met. And the resilience here that I've seen is the families come together through all of the loss that we experience and still be able to be a community at the end. And we're working together to take care of each other. And one thing I'm also on the powwow committee for my tribe, and we plan to have a powwow in September, but we had to cancel it because we were still going through the pandemic. And I think something that is important for us is to, as community leaders or as people who are working for their community, to have things to look forward to when as we get closer to the end of this. So I think that's something that I'm keeping in mind, is how can we keep our community looking forward instead of only at the loss.
Beautifully said. I'm sorry to do this to you, Mr. Wamigo. Would you like to follow up on that and share your thoughts on what is resilience?
Sure. So, these last 18 months, by far, they've been pretty challenging. But even before that, I think our Native community, we're pretty resilient. We're still here. We've had a lot of challenges. Many of us aren't located in our original homelands. We had our culture, our language, our ceremonies have been negatively impacted for hundreds of years. And so we're already very resilient. Whenever there's an event or something happens, our communities are really good about coming together. They're really good about putting, grudges, because, we're some of the most, we can hold a grudge for a long time. It could be many generations we can hold a grudge. But when something happens, when there's a tragedy, when there's something, a pandemic like what we have right now, a lot of those things are set aside, and we work together and we get things done. And we look at, what's best for our community, what's best for our elders, our children. I think, and I'm biased because I'm part of a Native community. I think we're like one of the most resilient communities that you'll find on the planet. Just we can pivot, we can react, we can try to plan for what's going to happen, but we know a lot of times we make the best plan, but something makes us push a little left or right, however it is. But so, I think we're already a resilient community, and this has brought to light a lot of what our Vice Chair Pamami said about some of the infrastructure needs we need. It's brought that to the surface, and so more people are seeing it. Like how we don't have broadband, our roads are inadequate, our whatever else, our water treatment facilities, whatever it is, we need to grow. We see our communities are growing. We need more growth, and we need those things. So I think we're very resilient now. But everybody coming together, working together, even different communities. So our communities up north, Kickapoo brothers and sisters, Iowa, Stack and Fox. Everybody's been. How are you guys handling this situation? What are you doing to combat these things? How are you still continuing to grow? I mean, we're pretty resilient already. So I think always look into how we're going to make things better for these ones coming up ahead. That's kind of would be my definition of resilient.
Wonderful. And as a non-Native person, I would say your bias is very well founded. There's so much that the white community could learn about resilience from our tribal communities. We'll make this quick. Zach, we'll take it to you next, and then Tim, you can wrap us up on your thoughts on what is resilience.
Okay, very quickly, I would agree with everything that's been said so far, and I would say just for me personally and as a nation, tribal nation, the ability to adapt is for me a key component of resilience. We've done that many times throughout our history. And also, I think along with that, the ability to ask for help when you feel that you don't have the answers or you're unsure. I know individually and as tribal governments, we don't always have all the answers. And I think a component to that is looking to other tribes, oftentimes looking to the examples that they've said. I think Chairman Rod's presentation today is a good example of what he's doing or what he's helping to do for his community in terms of agriculture and how that'll set us on a better path, not only just from the food sovereignty perspective, but also creating a better environment and way of life for our people. So that's what I would have to add.
And Chairman Rod, I think you're on mute.
Here we go. Yeah, that's a great question. And one of the biggest issues, or not really an issue, but you know, it's who we are as people. And we as Native people, like the group has already said, is we've you know, our old ones and our elders have endured all the sacrifices and the challenges and everything that they've went through. You know, so being resilient, I think, comes down to the actual person that you are and what makes us up as a person and what we strive for each and every day, not only for ourselves, but for the entire membership and our communities. You know, and one thing that, you know, strength comes in numbers, right? We've all heard that. And building the teams internally, tribal wide, you know, is going to be pretty important. And, you know, just trying to find ways to gain the trust of the tribal membership again, you know, because what I have seen, not only of the issues and all of the people dying, people getting sick, putting in the hospitals, not having hospitals to go to, you know, those were all issues that we had to face, and we rose above. So I want to leave with the group today, because I always tell the team members, staff, employees, and the executive committee, you know, and I want to tell each one of you, you know, I've strived for true north. And even though when that path ahead is tough and the road takes us, it curves, and we find ourselves heading northeast or northwest, right? But it's all okay. It'll be okay, because there's always a detour or a bump in the road, and it is our personal resolve and commitment of how we get to that end of our journey. So, you know, a lot of it comes down to who we are and what we're trying to build for each one of our communities. You know, and strength comes in numbers. So collaboration with other tribes, finding things that work and what doesn't work. And, you know, this networking is critical and key. Yeah. So, you know, with all that being said, I appreciate the opportunity today of being a part of this panel. And if anybody ever has any questions or any thoughts, you know, don't hesitate to reach out. But, you know, the message I would leave today is always strive true north.
Well, that gave me chills. Thank you so much to each one of you and to everyone in the audience, where I could feel your energy through the Zoom screen of listening to these powerful stories. Thank you again. I'm going to now make the transition and kind of, Dr. DeRoyan, I'm stealing the work from you, if that's okay, in the interest of time. Just
Sure.
remind our audience of what's happening next. Next up, we're so happy to have Stacy with us, and thank you so much for your patience, Stacy. She is going to lead us through an exercise break so we can get the oxygen going in our body. And when she is done, then we will have lunch, a break. Sorry, we can't feed you through the screen. And then we will restart at at 12:30 with mental health. So without further ado, Stacy, thank you again for joining us. And I'm going to turn my camera off so you guys won't see me fumbling following Stacy. Thank you.
Absolutely. Elizabeth, am I able to share my screen for a couple of slides?
Yes, you can.
Okay, very good. I will do that real quick here. I don't see that option here yet.
Stacy, while you're doing that, you work on that, and I will just say thank you, Elizabeth, and the wonderful 4 panelists. We really appreciate their sharing of their thoughts and their experiences over the last year and a half.
Okay, I think I might have it here.
Fantastic. We can see it.
You can see it? Okay, excellent. Okay, it's time for a movement break. How long have you, what time did you guys start today? Have you been sitting for quite a few hours here?
2.
Okay, awesome. Well, we're going to get moving. We're going to stand up first, but before we do, we're going to do a little bit of chair yoga today, and I love it because it's something anybody can do. A student sitting at a desk can take a break doing it. Somebody sitting in their office all day can do it, and somebody who just doesn't have the mobility to get a whole lot of standing movement can. It's also great for that population. So. Some of the benefits of chair yoga: improve strength. You can build some muscle here, improve flexibility. Definitely, we're going to get a little bit of stretching in. Improve proprioception. So that means you get a better feel of where your body is in space. And why is that important? It's what helps us with our balance. So it kind of is, the intentional movement is going to give us a boost to our balance. Reduces stress, something that we probably all can, as I hear you guys all talking about the stress of the pandemic within your own communities. This intentional breathing, intentional movement has been shown to lower cortisol hormone, so the hormone that is related with the harmful effects of stress. So even a few minutes can lower that hormone, which is beneficial. Studies show us that this type of intentional break improves our mental clarity. So if you've been sitting at your desk all day working, taking a break to do some of this movement allows you to come back maybe a little bit more sharper or more focused. So I always tell people, if you've got a problem and you've been struggling with it and you don't have the answer, walk away, take a break, and come back maybe with a different perspective. Reduces joint pain. Today, we're going to work through some of the major joints. And the more we practice that, the more movement, gentle movement is in our joints, the more it kind of warms up the synovial fluid in our joints, helps with joint pain, and improve pain management. Believe it or not, studies tell us that when we have intentional breathing, deep breathing, it releases endorphins into our body, which is kind of the feel-good neurotransmitters that help our body feel pleasure instead of pain. And so this kind of movement can be just as beneficial to mild pain as over-the-counter pain relievers can be. So kind of a lot of good things going on. I hope you'll find some good stuff here. This is a screenshot of some of the exercises we're doing. So the one thing I hear most often on Zoom is people wish that I could give them a handout of what we did so that they can do it themselves at their desk. So I'm putting this up on the screen. If you have your phone close by, or if you know how to screenshot on your computer, you are welcome to take a picture of this so that you have these kind of cues to do it on your own. I'll give you just a second here. And I can bring that back if we need to. I'm gonna take away the screen share and I'll put us up on the screen here and we'll get started. So if you want to maybe push your chair back a little bit from your desk and stand up, we're gonna get a little bit of blood flow in here. We're just gonna stand behind our chair to start off, holding on to the back of our chair for balance. And you're just gonna imagine you have a chair behind you and you're just gonna sit down into that chair, a little squat, and then stand back up. Just a few of those. Feels good to stand up. Couple squats here. Getting the blood flow in our legs. 2 more. Nice job. And then all the way up to tall, and we're just gonna do some heel raises. So lifting up on your toes and then dropping down. Good. Getting some movement back in our calf muscles. Just a couple more. All right, we're gonna combine it 4 times. Squat, stand up onto your toes. And squat, stand up onto your toes. 2 more. Squat, up onto your toes. Last one. Squat, and up onto your toes. Good. Lace your fingers together with your palms pointing towards you. And we're just gonna stretch the hands in front of us and think about rounding the upper back. So we're pulling those shoulder blades apart. And then we're gonna reverse our palms, still lace. Take a deep breath in and reach those hands up nice and tall. Maybe pulling your biceps behind your ears. And we're just gonna tip to the right. Little stretch down the sideline. And then tip to the left. And back to center. And release the arms. Go ahead and have a seat back in your chair and just bring yourself up to the front edge of your chair if you can. Nice and tall, you're gonna draw your shoulders up to your ears and just circle them back a couple of times. Rolling the shoulders. Good, and one more time. Let your shoulders kind of pull down your back and relax. We're gonna take our right hand, reach for the back of our chair. Our left hand's gonna cross over to our right knee. Take a nice deep breath in, nice and tall. As you exhale, you can kind of gently pull on that knee and just look over your right shoulder. Take a breath in. As you exhale, slowly unwind. And then take that left hand to the back of the chair. Right hand crosses over. Take a nice deep breath in, nice and tall. And exhale and look over that left shoulder. Take one more breath in. And as you exhale, unwind. Good. We're going to take it to cat and cow. You're just going to rest your hands on your thighs. As you breathe in, slide your hands to your hips and just lift your chest. Open up your chest, lift your heart, maybe lift your chin. As you exhale, your hands are going to slide over your kneecaps, tuck your chin, and round your back, almost like you're trying to create a turtle shell. Inhale, lift your chin, pull your hands back, lift your heart. Exhale, tuck and round. And one more. Inhale, lift. And exhale, tuck and round. So we have a little bit of flexion and extension with our back. Sitting up tall, our hands are going to reach to the side. We're going to take our right hand and just kind of tip your spine to the side as if you're picking up something off the floor, and then back up to tall. Keep both of your hips anchored into your seat so you don't fall out of your chair. Good. And one more, each direction. And last one. And back up to tall. A little bit harder, hands are going to come up like you're painting the rainbow in the sky. Your right hand is going to scoop and reach over while your left hand presses and reaches to the floor. exhale all the way back. Same movement. Good, one more. Inhale, scoop with the right and press with the left. And exhale and back over. So we've moved our spine laterally, which should feel good. Bringing that hand down. We're going to take a nice deep breath in. Sit up as tall as you can. Imagine somebody's grabbing you by the crown of your head and they're pulling up your spine. Thumbs point to the back wall. Open your hands up nice and wide. And as you exhale, bring your hands to cactus arms. We're going to pinch the shoulder blades together and once again lift the heart. Good. We're going to tip this whole upper body about halfway to our thighs. So you might feel your low back muscles fire up here as it supports you. Your spine is nice and long. Rest your hands on your thighs and go ahead and let your hands slide all the way to the floor. The crown of your head is just going to drop towards the floor and you might feel a nice stretch in your low back. Keeping your fingers on the floor, take a breath in and just look back up towards the computer and get a stretch through your back. And exhale back down. Take your right hand, point to the wall, and your eyes are going to follow your right hand. So it's kind of a twisted stretch. Take a breath in, exhale, and bring your hands back to the floor. Left hand points to the wall, eyes follow the hand. Take a breath in, exhale, and bring it down. Hands are going to come up to the knees and just sitting up nice and tall. Kind of reset that spine with a little bit of shoulder rolls. And we're just going to grab onto our right knee, pulling that knee up, and just take your foot and with your toes, draw some circles. Get a little stretch in the ankle joint. And reverse it. Good. And relax. We're going to take that right foot, straighten it out onto the floor so that our knee is straight and that our right foot is long. We're going to take our right hand and just scoop towards the outside edge of that foot and bring it up. Let's connect it with our breath. Take a nice big inhale as you scoop and exhale. Inhale, scoop. And exhale. Good. Right hand rests on the thigh. Take a breath in. As you exhale, slide your fingertips to your shoelaces and stretch out that hamstring. And bring it up tall. We're going to bring our right foot up onto the left. So we've got our right ankle kind of resting on our left knee with our chest nice and tall. Take a breath in and just tip forwards. Should feel that stretch in the back of your hips. If you've been sitting all morning, this stretch should feel good. And release it. Let's quickly do the other side here. Bringing up that left foot, just draw some circles. And reverse it. Good. Shoot that left leg straight out, straighten up your left knee. Take a breath in and scoop forwards. And exhale. Two more. Inhale, reach. And exhale. One more. Inhale, reach. Good. Left hand is going to slide all the way down the thigh. Get a nice hamstring stretch. Maybe you feel that in your low back a little. And then as you bring your spine up to tall, bring that left leg to rest on the right. Take a breath in as you exhale and just hinge forward and stretch it out. And relax. Last big movement here, you're just going to take your feet out wide and your kneecaps are just pointing over your toes. Bring your hands together, your pinkies, so you're creating like a scoop, and scoop to the floor as if you're scooping up a bunch of fall leaves. Bring those leaves up over your head and release. Good. Scoop to the floor, lift them tall, and release. Can you connect your breath? Inhale, breathe in, keep breathing in, fill those lungs, and out. One more, breathe in, last breath in, exhale all the way out. Resting your hands on your thighs, take your left shoulder and just point it towards your right knee. One last stretch in the back. Lift it up tall and point the other direction. Point your right shoulder to your left knee. And up to tall. Good. Nice movement. Nice work with your spine and your back. We're going to finish off with the neck. It seems to be the part of the body that I see a lot of people struggling with as we've moved more online. You're going to take your left hand and just rest it on your tailbone, kind of opening up through your shoulder. Take your right ear and just pour all the water out of your ear. Feel that stretch down the side of your neck. Sit here for just a second and take a couple of breaths in and out. On your next breath out, we're going to take this stretch and just look underneath your right armpit, looking under the arm towards the floor. And we want that stretch to go more into the back of the neck. And bring it up. All right, final stretch. Right hand rests on the tailbone and pour all the water out of your left ear. Breathing in and out. As you exhale, have a look under that left armpit, stretch through the back of your neck. And bring it up to tall. Great job. We're going to take those arms out wide. Just take a nice deep breath in. Bring those hands all the way up one more time, looking up to the ceiling. As you exhale, bring your hands to prayer at your heart. Pull your ears back over those shoulders. Tip your chin. Maybe feel a stretch in the back of your neck. As you breathe in, open your arms to the shape of a T. And lift your heart. Big stretch through the front of your chest, maybe through your biceps. And as you exhale, press your hands to the floor, making your spine just a little bit taller. All right, we made it through all of these exercises. Great job. I'm going to, let's see here. Can I share this one more time? Oh, yeah, here we go. All right, here's that screen with those exercises that we just did. If you want to get a screenshot of those, you are welcome to. I hope that your back feels good. You can do all these stretches at home. It's very gentle to your body. I don't think there's anything that ages us quicker than either being sick or unwell, or having a stiff spine. A stiff spine can make us feel old quite quick. So great exercises. If you have any questions, I'm going to leave you hopefully my email here. It's Stacy@reboundphysicaltherapy.com. I am a free resource to you. I love coming to your fairs in person and meeting you guys, but I am thankful that we have the Zoom option. So if you have any questions, you can certainly email me. And otherwise, have a great lunch. I'll let you guys go eat.
Oh, Stacy, thank you. This was a little present from Stacy to everybody today. So, and remember, she's at Rebound, and I think you're several places in Topeka, right?
We have two. We're on 17th and Fairlawn. And we are also on 37th and Burlingame.
Well, thank you so much, and thank you for coming back, and we'll see you next time.
Sounds good. Have a great lunch, guys.
Yes, thank you. So we have lunch until 12:30.
feel sorry. Lying here, no idea. And you.
Okay, I hope everybody had a good lunch. Next we have Tony Siebert, who is the behavioral health manager here at Prairie Bend Health Center, and Mindy Thompson, who is one of our counselors. And they're going to go ahead and share their screen and talk about mental health and substance use disorders.
Mindy, we can see your screen, but we cannot hear you talking if you're speaking.
Can you hear me?
Yes.
Okay, so I'm gonna do it this way. Can you see their screen?
Yes, it's small, but we can see it.
Okay. The beginning. Is that better? Is it bigger?
We're not viewing the slideshow mode. We're just viewing the actual PowerPoint as it's in like edit mode.
Okay, we'll do it this way. You guys talk here. I'm gonna go share your slides and just let me know. And I'll come back.
It's connecting to that.
I can't do anything here. Connecting to.
Can you guys see our slides yet?
Can you see? No.
It's still
No.
connecting in our end. I think Tiffany went back to her office to share our slides,
Right?
to share our screen, and then once that comes up, we can get started. Sorry about that. You have two non-tech people.
No problem. This is like a great prelude to the topic, because I know for me, trying to master technology has been one of my greatest stressors during the past 18 months. It's so much easier just to show up somewhere in person.
Yes.
Yeah, absolutely. Yeah.
I have to facilitate a panel later this afternoon using something called Google Jamboard. And I nearly joked when they told me that, because I'm like, I've never even heard of a Jamboard.
We got a screen that says, please join this meeting from your browser. We got an error code. Do we close it out or do we join from browser?
Whatever
So-
you're doing was working. Like if Tiffany can share your slides on her computer and your audio is working, don't do anything until we know if Tiffany can share your slides. That would be my recommendation.
Hey, Misty,
Yes.
did I send you their slides?
No, I don't think so.
I need somebody else. Can I send them to you and have you share your screen?
Yeah, I'm happy to do that.
For some reason, my internet is down.
For the Zoom.
Okay.
I would offer to help, but you don't want me to.
All due respect to Dr. D, I can vouch for that. I was terrified you were going to log off at lunch
We're not
and then not
attending.
get back on.
No.
Gee.
But I'm not going to take offense at your old lady glasses either.
Should we try to get back into the Zoom? Because we're not in the Zoom at all.
The internet is down at work.
Oh, that's why.
Yeah, that's what it is. So sorry, because it's taking a while. I have to run in between two buildings. Yeah. all
Okay,
of this
well,
going.
hey, Tiffany, can one of us committee members? Oh, it looks like Tandy's doing what I was just going to suggest.
I think
Tandy, you're a rock
that's
star.
what I was. Well, I don't know. This isn't official yet, but this is what I was going to try. And Tony and Mindy, we can hear you even if you can't, but I don't know if you can see your slides. Can you
I can
see
see-
anything
I
on
can
the
see-
screen?
I can see them on the phone screen here. Yeah. Okay.
Okay, wonderful. Well,
All
I'll
right.
try to share and you just tell me when to move forward. I'll need someone else to help monitor the chat box because I don't see it right now as I'm doing this.
I can do the
Okay.
chat box. I can do the chat box if you can share.
Okay.
Wonderful. I think we're up and going now.
Okay. Well, like the slide says, I'm Tony Siebert. I'm the manager for behavioral health here for the Prairie Band Potawatomi. And Mindy Thompson is here with me. She is probably got the most seniority of any of the staff out here. She's been here. How long have you been here, Mindy?
Or since 2008.
Yeah, a long time. So, and I've been out here working in behavioral health since 2015. So we can go to the next slide. Okay. Yeah. This is the new behavioral health building that was built. The tribe built this in 2018, where we moved in November of 2018. And it's a wonderful facility, and they recognize the need for behavioral health services out here. And so they made this commitment, which we're very appreciative of. Okay, next slide. The services that we provide out here as an organization is mental health evaluations, substance use disorder evaluations, dual diagnosis treatment. And when I say dual diagnosis, typically we see a lot of people that have a substance use disorder plus a mental health disorder. And so we will treat both. We offer individual outpatient counseling and psychotherapy, outpatient group therapy, couples counseling. We do referrals for residential treatment. We have 3, I believe, people out here certified to do anger management. We do an alcohol and drug information school. And that's usually for first-time DUI offenders. That we do crisis intervention here on site. We get a lot of crisis referrals from the medical clinic, which is across the street over there. And then we also added this year, we have a psychiatric APRN that came joined our staff. So we're now able to do medication evaluations and then prescribe psychotropic medications. Next slide. This is just a list of our staff. There's Mindy and I, and then Christine Starrett, she's a counselor out here. This is her second go around out here. She was manager of the department for a while, left and went to private practice and came. We were able to get her back here about a year ago. So Kara Arnold, I believe she's been out here 3 years, I think. Karen Russell, she's the new psychiatric APRN that came on board last year. Edie Wamigo is an extremely valuable resource out here, does a little bit of everything for us. And Charlene Zeller is kind of our front person out here at the front desk, but she's also a certified medical assistant. So she'll take vital signs and things like that with the patients that are coming in to see Karen. Next slide. Mental health problems and symptoms, causes and effects. Mental health problems can cover a broad range of disorders, but the common characteristic is that they all affect a person's personality, thought processes, or social interactions. Many of these disorders can be difficult to clearly diagnose. Looking at some data that was collected by the federal government, it indicates that 20% of the people in the United States suffer from some form of a mental disorder, and 5% suffer from a disorder severe enough to have significant negative impacts on school, work, relationships, and other aspects of daily life. Okay, next slide. Next. Okay. Mental health disorders occur in a variety of forms and symptoms and can often do overlap. This can make many disorders difficult to diagnose, and we'll get into that deeper a little bit later here. These following slides will identify many of the common disorders that affect people of all ages. Next slide. Okay, the first one we'll talk about is attention deficit hyperactivity disorder, or ADHD. That used to be called ADD, but they brought out the new DSM-5 diagnostic manual, so they kind of combined the two and put them together with different specifiers in there. ADHD is characterized by an inability to remain focused and on task, impulsive behavior, excessive activity, or an inability to sit still. Although this disorder is commonly diagnosed in children, it can occur in adults as well. We see this quite often out here, that where we'll take a history when we do a mental health evaluation, if a person was struggling in school, or maybe they had this diagnosis as a young person and they come to us as an adult, we kind of check that out and see if this disorder is still prevalent. Some people do grow out of this disorder, but typically it can last a person through their lifetime. Next slide. Anxiety or panic disorders. Anxiety disorders are basically defined by intermittent and repeated attacks of intense fear of something bad happening or a sense of impending doom. Panic attacks can and often do go along with anxiety episodes and are usually identified through physical symptoms, chest pains, excessive sweating, sometimes mild paralysis, nausea, blurred vision, kind of a whole range of somatic symptoms. And in the anxiety disorder arena or spectrum, that also is where obsessive compulsive disorders fall into that same category. And we've OCD is something a lot of people make jokes about and things like that, but we see that some people really suffer some serious issues with this that really debilitates their ability to function. Let's see, obsessions are defined by recurrent and persistent thoughts that are intrusive and unwanted. And then the compulsion comes in by the repetitive behaviors that people will do, like checking your locks a lot or washing their hands. Next slide. Bipolar disorders. Bipolar disorders cause a periodic cycling of emotional states between manic and depressive phases. Manic phases contain periods of extreme activity and heightened emotions, whereas depressive phases are characterized by lethargy and sadness. These cycles do not tend to occur instantly, and one of the phases will be predominant. You can also, with a bipolar disorder, people can experience psychotic episodes with some of them if they're serious enough. There's different types of bipolar disorders, but basically they're treated the same way with medication and therapy. Okay, next slide. Here we go. Depressive disorders. Depression covers a wide range of conditions, typically defined as a persistent bad mood, lack of interest in pursuing daily life. Also, bouts of lethargy, fatigue, and with hypersleep patterns. Dysthymia is a milder but longer lasting form of depression. And dysthymia is one of those depressions that you'll see people that go for years with this. I mean, 5, 10, 15 years, maybe their whole lives, they feel like they've been depressed. Depression disorders can indirectly cause physical problems too, like weight loss or weight gain, loss of libido, fatigue, and other physical problems. Next slide. Psychotic disorders or schizophrenia. Schizophrenia, this is not a very well understood disorder. A lot of people think it's commonly thought of as solely about hearing voices or seeing things that are not there. But what it is, it's defined by a person displaying a lack of ability to distinguish reality from fantasy. So there's a lot of delusional thinking, delusions of grandeur, paranoia, things like that. Psychotic disorders can cause extreme paranoia with beliefs in elaborate conspiracies and involving the patient. Next slide. We can go to the next slide. There we go. Post-traumatic stress disorder, or PTSD. It has a mixed feature presentation. And this is when we were talking a little bit ago about different disorders overlapping. We see this a lot with people that have a diagnosis of PTSD. They'll also have a diagnosis of maybe general anxiety disorder, plus maybe major depression. So then when I say it has a mixed feature presentation with depression, anxiety, paranoia, avoidant behavior, hypervigilance, exaggerated startle response, problems with concentration, and sleep disturbances. It can be related to a traumatic experience in one's history. Many times this disorder features a gap in memory, whereas one has repressed a traumatic memory and has difficulty recalling the event in its entirety. We tend to treat a lot of people out here with some form of this disorder. And typically, a lot of people think that the PTSD strictly goes along with a military experience, but typically it's experienced by a lot of people, maybe through their childhood, that were abused, neglected, things like that. So, next slide. We can go to the next slide.
Yes, just a second.
Okay.
Okay.
Oh, there we go. Personality disorders. This disorder it's marked by an enduring pattern of behavior and inner experience that deviates from expectations of the individual's culture. Enduring pattern that is inflexible and pervasive across the board, or range of personal and social situations. The pattern is stable and of long duration, with the onset traced back to at least adolescence or early adulthood. So we have to really gather a lot of history to make that diagnosis with somebody, because we need and usually we like to corroborate with families and get corroborated information to make sure that this person has behaved this way in a long period of time. It's a very difficult disorder to treat because the pattern is so pervasive, and getting people to recognize that this is actually a disorder is probably one of the biggest barriers to it. So, but the types of these personality disorders are, maybe you've heard of some of these: borderline personality disorder, antisocial, narcissistic, histrionic, avoidant, dependent, and obsessive compulsive personality disorders. Go to the next slide. Okay, treatment for mental health disorders. The most successful way of treating a mental health disorder is often a combination of psychotherapy and medication. And basically what we're talking about is psychotherapy is about creating behavior change, and then medication creates a chemical boost or blocking whatever it takes in the brain. So, but the combination of the two is where real healing comes in. The psychotherapy approaches encourage behavior change. If these changes are applied consistently, it has been shown it will actually alter brain structure and become the person's new normal. So that's the old adage of fake it till you make it. If people act in a different way, they will actually retrain their brain. Psychotherapy approaches include cognitive behavioral therapy, dialectic behavioral therapy, motivational therapy, among others. There's also a brain-based therapy that we have two clinicians out here use. This one is eye movement therapy, or EMDR, and plus brain spotting. Those are two brain-based therapies that we use out here as well. Go to the next slide. Medications, antidepressants, these medications treat the symptoms of depression, but in some cases may also be prescribed for anxiety or insomnia. Anti-anxiety meds. These medications can help people who suffer from general anxiety disorder, social anxiety, or have panic attacks. Benzodiazepines, that class of drugs, are the most commonly prescribed short-acting anti-anxiety medication. The problem with those is these drugs are meant to be used in short term because long term they can lead to physical dependency and addiction. There are some non-habit forming anti-anxiety medications that can be prescribed in the place of benzodiazepines, and we usually encourage people to try those first. Next slide. Mood stabilizers. These are typically done for people that have a bipolar disorder. The medications are or any disorder related to mood, just to stabilize their mood. And they will prevent significant mood swings, mania and depression. We've had some really good luck with some of the new mood stabilizing drugs that they have out there that have few side effects, but people do have to take them as prescribed. Antipsychotics, this class of drugs are typically prescribed to treat schizophrenia and other psychotic disorders. Sometimes they're also prescribed to individuals with a bipolar disorder and are experiencing psychotic episodes. And these psychotic episodes usually happen during a manic phase of a bipolar disorder. ADHD medications, typically the medications that are prescribed for this disorder is some type of stimulant, such as Ritalin or Adderall. These drugs can be habit forming as well and are considered controlled substances, but there are some other non-habit forming medication options as well. Next slide. Okay, I'm going to let Mindy take it from here. She's our substance use disorder specialist, and then we'll, when she's finished, we'll take some questions.
Hello, everyone. You are cute. Okay. Thank you guys for inviting us to take part in the Tribal Health Summit. We appreciate it. I'm going to start off by saying I'm not used to doing presentations. So I'm going to do my best with this, and then we'll have a opportunity. I have a lot of slides, and I think we'll be able to get through them. And then at the end of it, we'll take some questions. All right, so substance use disorders, some definitions and symptoms. A substance use disorder is just a pattern of alcohol use, methamphetamine use, marijuana use, any kind of substance that causes pretty significant impairment or distress for a person. And so we're looking really at how that substance use affects the functioning, a person's ability to function, and then a lot of different aspects of their life. When we're looking at symptoms of a substance use disorder, we use the DSM-5, a diagnostic manual, in assessing if somebody can be classified as having a substance use disorder. And there's 11 criteria that we're looking at in seeing if an individual meets. They have to meet at least 2 of the 11 criteria to get a diagnosis. And then that is defined as a mild severity of a substance use disorder, a moderate severity, or a severe. And that's based on how many criteria of the 11 that they meet. But they're really, those 11 criteria are focused on loss of control. So a person's experiencing some intense cravings or strong desires to use whatever that substance or substances is. And whether they're giving, like if their cravings are so intense, they're giving into that, or it's interrupting. The cravings are so strong that it's interrupting their functioning. And then we're looking at, are they trying to not use or cut back or control their use? Can they do that? And is it difficult for them to do that? Like saying, are they cutting down in the quantity that they're using, or how often? So the frequency if they're using. Another category is focused on social problems. Is the use that they're involved in, are they neglecting other parts of their life, like their work? Is it affecting their work, or going to school, home, using even when it causes problems in their relationships or at work? So they know that the the use is causing some problems, but they're continuing to do that. And then we're looking at, is their use risky? Continuing to use despite physical or mental health issues. So if they already have like if somebody's diagnosed with diabetes or any other kind of medical condition, or if they are diagnosed with a mental health disorder like depression, anxiety, and their substance use is making those conditions worse. And then we're looking at frequent use in situation which it's physically hazardous. So, obviously that's, continuing like driving or operating machinery under the influence. And then we look at drug effects. So do they have tolerance? And tolerance is the need for larger amounts of the substance to get the same effect. Or are they experiencing reverse tolerance? So that means they don't need as much of that substance. And that usually when there's reverse tolerance occurring, that usually means that there's some type of physiological effect happening. And typically that looks like the liver cannot break down the substance as efficiently as it once was able to. And so the substance is staying in their body for a longer period of time. And then is that person experiencing withdrawal symptoms? So the withdrawal symptoms are what occurs after a person stops using for a period of time. And those withdrawal symptoms vary depending on what the substance is. Next slide. Okay. How does the substance use disorder lead to changes in the brain? So repeated use of the substance, whatever that substance or substances is, leads to changes in the brain structure and functioning related to judgment, decision-making, learning, comprehension, memory, and ability to control your behavior. So we're looking at how it does that is through intense cravings for a substance, changes in someone's personality, abnormal movements, and other specific behaviors, and also looking at how does substance use change the brain. It's really focused on the activation of the brain's reward system or pleasure system, as you may have heard it called. What it does, and just let me share that I'm not a medical expert. That's not my forte. So just making some generalizations in layman terms. What happens is, whatever the neurotransmitter or the chemical is, so it floods the synapse with dopamine. Thus, really what's happening is there's an overstimulation of the system producing euphoric effects, which strongly reinforce that behavior of using because it feels good. You have a sense of pleasure, either you feel relaxed, and those are things that makes us feel good. And so what happens is that gets reinforced through the using. And then reward system pathways become wired to the brain's natural chemical release of dopamine, which dopamine is a neurotransmitter. Next slide. So we listed these 4 substances. I think when we were asked to do a presentation, they wanted us to talk a little bit about what are the most prevalent substances that we see in behavioral health when people walk in the door. What are they using? What are we seeing? But please know that we treat a lot of people, not just in this community, not just on the reservation. We get a lot of folks from the whole northeast part of Kansas. We treat people that live up on the Kickapoo Reservation. We get a lot of referrals from Haskell and Lawrence. So our program serves any federally recognized member, Native Americans. So we get people from all over the state that will call us in, try to engage in services here. some of that we've been able to do that better through the use of telehealth when people can't actually get here to our building. But so this is what we see coming into the door, these substances: methamphetamine, a lot of methamphetamine, alcohol, different types of opioids or opiates, so pain medication, most of the time, and marijuana. And I want to say with opiates, most of the time, that's not someone's primary substance that they're coming in for. What we find out is usually it's another substance first. That's their primary drug of choice. But then, they are abusing some type of opiates. We find out later on down the road. What do you say, Tony?
Yes, absolutely.
Yeah. Okay. Next slide. Okay, so we're going to talk about methamphetamine first. And so, what is methamphetamine? So it's a Schedule II stimulant. It's under the Controlled Substances Act. It's meaning it's a high potential for abuse. And currently it has an accepted medical use to be prescribed for either weight loss or ADHD. Methamphetamine is a white, odorless, bitter tasting. I don't think that's on that slide. Nope. Bitter tasting crystalline powder that easily dissolves in water. It's synthetic, so it's made from a man-made from a bunch of different things that can be smoked, snorted, injected, or eaten, taken orally. It's easily made in small clandestine labs with a lot of over-the-counter ingredients. In the formula to make methamphetamine, there's a lot of different recipes for that. Anything under the kitchen sink. Methamphetamine cooks can be very creative in doing this. Okay, so looking at some short-term effects. When using methamphetamine, it's a stimulant, and so it's going to get things going. So it increases it acts on the central nervous system. So it increases things like your blood pressure, your body temperature goes up, faster breathing, rapid or irregular heartbeat. It creates a loss of appetite, which is why it can be prescribed for weight loss. Disturb sleeping patterns or feelings of nausea. Some of the behavior is erratic, aggressive, can have irritable or violent behavior, and increased wakefulness, increased physical activity are some of the short-term effects of methamphetamine. Okay, next slide. Long-term effects. So because it speeds up the central nervous system, and you can tend to have permanent damage to the heart and the brain because it has to work harder. High blood pressure leading to heart attacks, strokes, death. We've had a lot of folks present into the ER because they felt like they were having a panic attack, or they were having an anxiety attack because their heart is just beating so fast. And it's really due to they're pretty high. They've been using and being up on meth for a long time, and they feel like they're going to have a stroke, right? And so they present at the ER, and do they give them anything at the ER when they present?
Not typically.
No.
Yeah.
I mean, usually if they share that they've been using, they're just going to monitor them for a little bit and then be released. There can be long-term anxiety, confusion, insomnia, because most people who are using methamphetamine can binge use, which means they're going to use for days at a time. And so they're not really sleeping. And so when they crash and they come down, they're going to have struggles with insomnia. They can have paranoia, hallucinations, mood disturbances, delusions, violent behavior. Typically, somebody can have a lot of psychotic symptoms that can sometimes last for months or years after their methamphetamine use. Sometimes the methamphetamine produces and mimics some symptoms of some other mental health disorders.
Yeah, I might talk about that in just a second. That's a good point. Methamphetamine users sometimes their behavior will mimic someone with a serious bipolar disorder because when they're high, they're up and they're manic. And then what happens is they're finally your body just kind of gives out, depleted all of the dopamine in your body. So you have no choice but to crash. And when they say crash, then they may sleep for days. And then usually that's followed by a depressive phase in there too. So sifting through that and making sure that someone doesn't have a methamphetamine disorder between a bipolar disorder sometimes is difficult if people aren't honest about their drug use. So anyway, that's
okay.
I guess that.
And then the other two, intense itching causing sores from scratching, premature osteoporosis. Next slide. Okay. So methamphetamine is pretty awful in terms to oral health, and there's a lot of different reasons for that. Some of it is that just of what goes into making methamphetamine, right? So when we talk about, it can be made from anything under the kitchen sink or bathroom sink, there's a lot of acidic content to methamphetamine. And so what that does is it really damages the enamel of our teeth. And so it can cause sensitivity. And then the other thing is poor diet, right? People who are using methamphetamine, what we see is, they're not eating healthy. They're eating a lot of processed food, high sugary content, carbonated drinks. And that is if they're really even eating, because methamphetamine suppresses your appetite. So when they do eat, they're eating less often and they're not eating the greatest things. And then which then calls for just a lack of hygiene, right? What we see is a lot of folks aren't getting to the dentist on a regular basis at all. So lack of brushing, lack of flossing, which is leaving all that, those substances on the teeth for long periods of time, and lots of tooth decay is what happens. Xerostomia, that's dry mouth. What that does is it reduces that protective saliva around your teeth, so it makes them more susceptible. And then the clenching or the teeth grinding, which can continue to happen, after somebody has stopped using for a long time. People will still engage in that kind of behavior. One of the things that when we do substance use disorders here, and somebody's, that's their preferred drug of choice is methamphetamine, it's pretty standard for us as part of the recommendation to recommend that they get a dental health exam to address those concerns, because many people have decaying teeth. And when you're in pain from your teeth, you're kind of crabby and you're irritable, right? And so part of that holistic recovery process to address our not only our substance use, but physical and dental health concerns. Next slide. Okay, this is just this is a slide that, I just got this off the internet, just an overview, a side view of the brain. So I had said earlier in a couple slides, meth affects heavy or long-term meth use damages the brain both functionally and structurally. So once a person stops using, the altered biochemical activity that meth has played a role in that can take a significant amount of time to kind of stabilize or normalize. And sometimes, we say that can be anywhere from 18 months or longer, especially with a lot of heavy or long-term use. Structurally, meth causes damage to brain cells. The ability to reverse that damage really depends on where that occurred inside the brain. Is there anything you want to talk about that, Tony? Okay. Okay. 3 ways long-term meth use damages the brain, again, causing acute neurotransmitter changes. It really alters the systems responsible for delivering messages throughout the brain, transporters and receptor sites. Transporters and receptors are responsible for regulating mood. It also causes brain cell death, known to cause death in parts of the brain associated with self-control. Damage in these areas can manifest with a variety of psychiatric symptoms. And then it rewires the brain's reward system or the pleasure center. Changes to the brain's reward center are largely responsible for cravings. And we talked about that earlier about reinforcing that behavior. Next slide. Okay, in a nutshell, how meth gets you high? We get that question a lot. So the brain is comprised of a bunch of neurotransmitters, which are brain chemicals that send messages from the brain to the body. And meth affects a number of those neurotransmitters, but the most affected is dopamine, because that's really responsible for pleasure. When triggered, like eating your favorite piece of dessert or playing your favorite game, dopamine sends signals to various parts of the body and the brain, and then it's stored for later use. When you use meth, an excessive amount of dopamine is released into the brain, and it gets stuck in the synapse, which is the area between two cells. And so then you end up feeling this euphoria because there's a lot of dopamine trapped in there. So unlike normal brain functioning, the dopamine released is not recycled and stored for later. What happens is now you're overstimulated. It remains in the body until the high is replaced with the crash of unpleasant feelings. And then in order to replicate that pleasurable feeling and avoid that crash, you'll want more and more of the drug at higher doses. And then essentially tolerance develops. What to expect after you stop using, the restoring of some normal brain functioning happens, and that varies again based on how long somebody's been using, the aging process, and how regular. You start to see some improvement within 6 to 12 months. But for chronic users, it takes many, many more months for that to happen. And then cravings can persist long after your using has stopped due to the compromising of your reward system in the brain. Next slide.
Well, all right, here, Tiffany, how much more time do we have?
Looks like we have maybe about 10 more minutes.
Okay, well, maybe we can go through this kind of real quick, the rest of this, and because I want to leave a little time for questions as well. And the other thing is anybody that wants a copy of this presentation, they can email either Mindy or I, and we can get you one. So, okay.
Okay. Skip that slide if you would to the next one. Okay, so alcohol. So these are just some indicators that I got from SAMHSA about risky or excessive drinking. So really we're looking at, you drink more than you intend to drink, you drink longer than you intend to drink, you try to cut down, but you're just not able to, for whatever reason that is, you're just not able to really stick to what you say you're doing. You're getting some feedback from family or friends about their observations about your drinking. And then you're continuing to drink, even if it makes you feel depressed or anxious or adds to any kind of other health problem. And then we are also excessive or risky drinking, really looking at those withdrawal symptoms. Are you experiencing withdrawal symptoms like shakiness, sweating, tremors, headaches, anxiety, irritability, or is it causing you some insomnia? Okay, next slide. There's short-term effects from alcohol use, can be mild to severe, trouble concentrating, loss of coordination, passing out, vomiting. Next slide. Some long-term effects is, is your memory being affected? Is it causing you to have trouble concentrating? loss of your attention span, trouble learning, and medically, is it causing or contributing to liver damage? Consistent alcohol abuse, liver can become inflamed, possibly leading to fatty liver, alcoholic hepatitis, or even cirrhosis. And then looking at the heart, consistent alcohol use makes the heart work harder. Next slide. So we offer medication assisted treatment here, and two forms of that are through naltrexone, which is through a pill that somebody takes every day. It binds to the endorphin receptors in the body and blocks the effects and feelings of alcohol. So you don't really feel that euphoric feeling if you drink while taking naltrexone, it blocks that. And so it kind of reduces the behavior associated with or feelings associated with drinking. And then there's also an injection, and that's Vivitrol. So naltrexone and Vivitrol are basically the same thing, but Vivitrol is the injection that you get once a month. And our pharmacy here offers both naltrexone and Vivitrol. For somebody to get either one of those, though, they have to be in services with behavioral health. So you just can't take that and not have any type of therapy services. Treatment, there's detox programs. Closest is in Topeka here. Residential treatment, and then intensive outpatient treatment. Next slide.
Okay, maybe just so we leave, has anybody got any questions before we go on, or if we could leave it here and take some questions if you want.
Okay, so there was a couple of questions.
Okay.
The first one, Dr. Deanne DeRoyne said, is anger management often, sometimes, or rarely part of bipolar disorder?
Oh, well, that's a very good question. Yes, I mean, but people typically can learn how to manage their anger through behavior change and also learning different coping skills, which is a lot how we try to treat the bipolar disorder as well. Bipolar disorder cannot be very effectively treated with therapy alone. Whereas somebody that has an anger problem because of the environment they grew up in, or well, a variety of reasons, the anger management curriculum we use, if they practice, what we teach them to do, they can reduce their incidence of anger quite a bit. But you'll see anger outbursts for sure with people that have a bipolar disorder, especially during the manic phases.
Okay. The next question is from Misty Slater. What should we do if someone we know is experiencing a mental health crisis?
Another very good question. We make it it's our policy over here during the hours that we're open to take all calls with anybody in crisis. We will make room and fit them in our schedule during the day if someone's has suffered an emotional crisis. And then we'll try to assess them if it's severe and they're having a lot of suicidal thoughts, and we feel like they're in danger. We will get them transferred to a crisis facility in Topeka. There's also, we supply people with crisis hotlines that they can call. If over the phone we determine that someone is in danger of suicide, we will call the police to do a welfare check, but we'll highly suggest that they call the crisis hotline or call one of the crisis facilities in Topeka, and we'll follow up with that as well. Let's see. But we really try to do the best we can with that, and during our open hours here. So we'll also do a safety plan if somebody comes in crisis, and before we let them go out the door, we'll go through a safety plan with them, which supplies them with phone numbers, gives them coping skills that they can use when they're maybe at a high state of emotional disturbance. Just quite a few different things like that.
Okay, that's it for the questions. Thank you, Tony, and thank you, Mindy.
You're welcome.
Like I said, if anybody wants a copy of this slideshow, we'll be glad to supply it to you if you just contact us here.
Okay, you guys can contact them or you can send me a message and I can get it to Tony
That's
and
right.
Mindy, and then they can go ahead and send that out to you.
Yeah, okay. Oh, do we have just a few more minutes here?
Sure.
Okay, Mindy has something here that I think kind of important too on education with the fentanyl or slide. Oh, maybe you probably don't have the slideshow up anymore, do you?
No, it went down.
Okay, that's all right. Well, anyway, one drug that we do need to really draw people's attention to is this fentanyl issue in this country, because they're using it's a very powerful synthetic opioid, and people are cutting it and using it in marijuana. They're using it in other types of drugs. It's very, very dangerous. I mean, a handful of that stuff is enough to kill 100,000 people. It just very little bit of it is lethal. And this is why it's so dangerous for people to buy these street drugs and take them, because if it does have fentanyl in it, you could die very easily from that. So, and she's got some really good information on this slideshow in here about that. So,
Okay, and here's that slide, just in case you guys wanted to see it.
okay.
Well, thank you very much again. So next we'll go back to Dr. DeRoyne. Dr. DeRoyne, you're on mute.
Thank you.
Thank you.
Can you imagine that? So, yes, thank you both. This was very good. And I think we need to gather again so that you can talk to us about what your experiences have been during the last 18 months with COVID, and if you've been seeing more patients, and how our mental health has been affected by coping with the virus. So thank you very much. And so now, for our last presenters this afternoon, we have two important guests coming. And I know that Tom Anderson is here. I don't know if Dr. Garcia has checked in with you.
She has.
Oh,
She's here.
wonderful. And I'm not sure if they've decided who is going to go first. And so I will just say that Tom Anderson is the CEO of the Association of American Indian Physicians. And our organization actually does lots of different kinds of health interventions and public health education throughout the country. And presently AAIP, and particularly through Tom, there is a grant with the CDC to increase COVID vaccine as well as other resources to Native communities. And so Tom is going to talk to us about that. And then Dr. Jimena Garcia is Governor Kelly's senior advisor for vaccine equity. So she is actually working to increase vaccine availability to all communities. And she has done some special research for our conference today to look at the rate of COVID infection in Native communities in Kansas. So both of these folks have some really interesting things to share with us. So welcome, Dr. Garcia, and welcome, Tom, and we look forward to your presentations.
Well, thank you, Dr. DeRoyne. I'm going to defer to Dr. Garcia. I think that you going first will kind of set the stage. So if you don't mind.
Okay, I'm happy to do it. Thank you. Okay, let's see how good I am. I'm going to try to share my screen.
Great.
Okay. Okay. Oh, that's great. It worked. So I just want to, first of all, thank you very, very much for having me here today. I really feel honored to be included in this Tribal Health Summit. And I'm going to just spend a few minutes sharing information with you and then answering any questions that you have. So just what I'm going to cover today. So I want to talk a little bit about the Delta variant of COVID and why it has made things so much worse for us as a community than the original COVID strain. I'll then talk about the way that vaccination rates grew in the Native communities in Kansas and the excellent numbers that you all have had, really great successes in vaccination rates. And then I want to share some resources that are available to support local groups who want to do work in terms of in the vaccine effort in the community. And I'm going to end with any questions you have. I'm just double checking. Can you all hear me okay?
Yes.
Yes. Okay, great. Okay, so I hope you're okay with a few data slides to begin with. So this slide shows the COVID case numbers since July of 2020. And so the vertical axis is numbers of cases and the horizontal axis is time. So if you look at that light blue line sort of in the middle, that represents cases in Kansas. And the other lines are rates in our surrounding states. So what you can see is that we had a peak in cases at the end of last year and into the beginning of 2021. But as the vaccine became available, the cases dropped and we reached a low in the spring. And then in early summer, that's when the Delta variant appeared. And so that's a strain of COVID that's much more contagious. So just that is an example of how much more contagious it is. The original strain, if somebody was infected with it, would on the average infect 2 to 3 other people. But now with the Delta variant, a person that is sick with the Delta variant can actually infect 5 to 8 people. So what starts to happen to cases when the Delta variant takes hold in Kansas is that the cases start going up dramatically to levels that we had not seen since January of this year. So here is just some more information about COVID in Kansas. So starting on the left and moving to the right, the leftmost graph shows us daily cases of COVID, which have continued to increase to new highs. We had like a little dip, but I think that's sort of like a Labor Day data blip. So we really see things continue to rise. Moving to the second graph, very somber information, and that's deaths. Deaths have hit a new high in Kansas, and we're at a death rate that has not been seen since February. The next box to the right represents testing, and this is kind of good news. So we've had an increase in testing, which really helps to slow the spread. And the far right shows, can you all see my far right, or do you see my little screen with the people? You see it? Okay, good. The far right box shows that vaccination has been dropping, and which is really not so good. So here is a snapshot of the status of vaccination in Kansas. So the top line is those who are fully vaccinated. So people who have gotten 2 doses, and the bottom line is people that have gotten 1 dose. So you can see that in the adult population, we have about 61% of people fully vaccinated. And then the middle is eligible population. So right now, the COVID vaccine is only available for ages 12 and up, which might change sometime soon, but as of now, those are the people that can receive it. So of people that are eligible for vaccination, 59% are fully vaccinated. And then the final top circle on the right is total population, and that includes all Kansans. So that rate goes down because it includes people that are not eligible yet for vaccination. So we're almost at 50%. Okay, so I want to shift and focus on, wait a minute. You can tell I'm not that good at this. I'm like going, sorry, hold on. I don't know how I did that. Okay, here we go. I want to focus on COVID vaccination, specifically in the Native American community in Kansas. So this slide shows the rate of Native American vaccination broken down by age. So the brownish line, that big steep line on the top, and the gray line, the one underneath it, those represent age groups 50 and above in the Native American community. And you can see that older Native Americans and elders were vaccinated at a very fast rate. So you all had given out 64% of all the doses that were given before Kansas even entered into phase 5, which is when the vaccine was eligible for the general population. So it's really a testament to the community and to the way the vaccine was rolled out. So that's amazing. Now, the blue line at the bottom represents vaccination in children ages 5 to 17. So the vaccination rate in kids has gone more slowly. I feel like this is the data that we have, but it's not really fair data because it's 5 to 17-year-olds, and as of now, 5 to 11-year-olds are not eligible for vaccination. So I think this overrepresents the lowness of vaccination, if you will. And then I promise this is the last data slide. So this slide shows us Native American vaccination rate compared to the whole state of Kansas, and also to the US population. And this data is a little old, it's from August. It's the most recent we could get, but you can see that Kansas American Indian vaccination rate is the same as the vaccination rate in Kansas overall. And in adults, specifically, the Native American vaccination rate is higher than it is in Kansas overall, and it's closer to the vaccination rate for adults in the US population. In kids under 18, again, the rate of American Indian vaccination is lower than in the state by a bit, and also a little bit lower than the national average. So I want to just shift now to, okay, so we have the Delta, we have all this going on. What can we do as a community to really keep ourselves and the rest of the community safe? So it's really, we have 3 strategies at this point to improve health outcomes. So the most important one, and the first one listed here, is vaccination. So vaccination essentially prevents hospitalization and death from COVID, even with the Delta variant. So the vast majority of people that are sick in the hospital or dying of COVID now are people that have not been vaccinated. So that's the most important thing to do. Be vaccinated if you're not. Then the next is testing. So I think a strategy would be test often, especially, for example, in kids that can't be vaccinated yet. Up to weekly testing makes sense. And that's important because, well, first of all, kids sometimes can have COVID and they don't seem very sick. It seems like a little bit of cold and that's it. But kids can spread COVID to others. And so by getting tested, you identify who's contagious, and you can keep that person apart and not spread the virus to other people. And then finally, on the far right, masking. So masking cuts way down on the transmission of the virus. So pretty much everybody in Kansas, I would say, should be wearing a mask, whether you're vaccinated or not, when you're out in a public place around people you don't know, where you can't actually socially distance. So, I mean, I just want to say masking, like when people say masking doesn't work, I mean, we know for years doctors have worn masks, and we want doctors to wear masks when they're doing surgery and so forth. So masking does work. This year we had like the lowest rate of flu that we've ever seen, and a lot of other diseases that we usually see in winter. And we think it's a combination of social distancing with masking. I want to spend the last few minutes talking about a new grant program that we have available. It's called the Pandemic Assistance and Vaccine Equity Grant. And because everything in government has to have an acronym, it's called PAVE for short. So the PAVE grants, actually, I'm very excited about it. We've worked on it for quite a while, and I wish that it was going to be available sooner, but it's out now. So at the state, we're really committed to supporting local groups who want to do vaccination work in their communities. So these grants are available to all kinds of community groups, and they're grants up to $10,000, and a variety of groups can apply for them. So here are some examples of groups that can apply for these grants. So clinics, colleges, community groups, faith-based organizations, Kansas tribes, nonprofits, and others. And the funds are pretty flexible for vaccination efforts. The one thing that they're not allowed to be used for, and that's because it comes from the CDC and it's the way the funding comes to us, but it cannot be used for incentives. But other than that, I just wanted to share some examples of what you can use funding for. So local education campaigns, media buys, supplies to help support vaccination events, transportation if people need assistance and vouchers and taxi service, you can use it for that. Also for personnel that you might need, for renting facilities, and for not media support, like support for making flyers or so forth, for getting the message out. So there's a lot of uses, and I will share the link so that if you're interested in applying or you have groups that you want to share it with, please share it far and wide. And I've come to the end of what I wanted to share, and I'm happy to stand for questions. I'm also looking forward to Tom Anderson's presentation. So thank you again for having me.
Thank you very much. That was really great information. I'm not sure if you heard me, Humana. I just said that, yes, great. So I think maybe we should hold the questions until Tom is finished and we can do the questions together. Does that make sense? Okay, great.
Can you see that, or is that too large, Dr. Duran?
We can see part of it. Oh,
Okay, I'll make it.
it's being adjusted.
Okay.
Oh, there we go.
Okay, is that okay?
Yes.
Well, it's truly an honor and privilege to be a part of the Kansas Tribal Health Summit. Say thank you to the Planning Committee as well as Dr. Duran for including the Association of American Indian Physicians in this important and informative discussion today. If I may, I'm going to talk to you just for a moment about the Association of American Indian Physicians. AAIP is a member organization with members around the country in Indian country. And Dr. Duran has been a member for a long-term member. One outreach of AAIP is to encourage Native students to take the next step in their educational journey and to consider the health professions as an option. Its mission is to pursue excellence in Native American healthcare by promoting education in the medical disciplines, honoring traditional healing practices, and restoring the balance of mind, body, and spirit. We're a 50-year-old organization starting in 1971 in August. With that, I'm going to share some thoughts with you today about COVID-19, the Delta variant, a little bit about vaccination, some myths and misinformation, so maybe we can touch on vaccine hesitancy and a few other counter arguments. Because I think where we are, as Dr. Garcia had mentioned, the low-hanging fruit, those who want to get the vaccination have already gotten it. So now then, how do we handle those relatives of ours that say, no, I'm never going to get vaccinated? And some of these arguments you're familiar with. You know, our elders have almost universally in Indian country have demonstrated the importance of getting vaccinated with high success rates of vaccination. So we use that as an example, and I'll move on down here to the next slide, and that is on myths and information. May be hard to see, but I'll read some of the sources that we have. A lot of people go to Google and get information on vaccine and deem whatever they read as accurate and credible. So how do we know resources are accurate and credible when we're browsing the internet or talking to people? And my suggestion would be to talk to a healthcare provider, be it a physician or a dentist or a pharmacist or a nurse practitioner, about what is accurate and credible and what isn't. Another item that you might hear will receiving a COVID-19 vaccination make me sick? And in some instances, some people, a very small percentage, do have some side effects, although they're typically minor. Very, very few, and Dr. Garcia can attest to this, get noticeably sick to where they're down and out or have lingering side effects. You know, I've even heard myths, well, maybe it doesn't impact you now, but it will 3 years down the road, and your DNA is going to be altered, and a lot of these other things. Another misinformation is, does COVID vaccine cause you to be magnetic or electromagnetic? Does it cause you to start giving off waves? And you know, a lot of these seem silly, but they're pertinent objections, I guess, that you need to be aware of when people, because it's almost down in the trenches now, because it's convincing people one-on-one of why it's important to be vaccinated. Which of the COVID vaccines authorized in the United States shed or release any of their viral components? And I think that we can safely say none do, because they're not a weakened version of the virus. None of the vaccines authorized in the US contain a live virus. It's just some of the, does COVID-19 alter, change my DNA? And I think that it's a consensus, no, it doesn't impact. It's made with the mRNA, which is completely different than your DNA. Well, getting COVID-19 vaccine caused me to test positive for COVID-19 on a viral test. Does COVID-19 contain a microchip? Many people have felt that this was another government intrusion, that they're going to sneak in a microchip to mark you in some form or fashion. Will receiving COVID-19 cause infertility, whether it's male or female? And again, these are items that people believe. Moving on, since COVID vaccine doesn't protect against, I've heard that the COVID vaccine doesn't protect against the Delta variant. So if that's the case, why do we need the vaccine? And are those who do get the vaccine, do they become the super spreaders? These are other things that we're confronted with. And then I've heard this reason recently, well, I place my trust in the creator or God, not man, so I'll take my chances. So I share these thoughts with you because this is Delta across this country, and it is killing people. It's killed maybe some of your friends and relatives. I know it has mine. So I share these things with you that we can't take this lightly. It is a pandemic. It is an epidemic in this country. And we all have to be on guard, and we all have a role in the public's health. And whether it's dissuading someone or a relative, then we have to be armed with correct information to do that. We all know that to get tested, who should get tested, and these are some of the signs and symptoms. Not everybody presents all these signs and symptoms, or in some cases none, but we certainly need to be cognizant of what these signs and symptoms are. We know about the test, the PCR test, as well as rapid testing. We should be thinking as a tribal leader to think about making more of the PCR tests become available, that it takes, that I don't know whether we need to be more diligent in having our testing become more common, because I think that a lot of places are out of these tests. So why should you get vaccinated? Let me touch on that. You know, I think it's about protecting our culture. You know, we've got a lot of offspring, we've got a lot of relatives that all participate. We want to respect our tribal culture. We want to protect our tribal community. We want to protect your family. These are all relevant reasons in my mind that we need to be thinking down the road a little further rather than just about me. We have a lot, we've been resilient, as was talked about earlier today. And we need to continue to be on guard and diligent as we move through this pandemic. So rather than lecturing, I think at this time, I do want to let you know that there are resources out there if you want information from the association or from the CDC. You can go to these websites to give you accurate information. And if you need to contact me, I'm certainly right here. Here's my contact information and phone number. So with that, we will stop here and maybe have time for a few questions. Dr. DeRoy, I'll turn it over to you.
Yes, I'm sure there are questions. And I don't recall who was going to keep track of the questions for you and Dr. Garcia. But we will figure that out shortly, I trust. And let me get back to the chat. Okay. At the moment, I don't see any questions in the chat box, so I could actually ask either of you if there's anything you wished you had said. I think that I've been wondering, for example, we are so happy that so many of our elders in our various communities were very positive about getting vaccinated. And the focus certainly was with them initially for several reasons. And I've been wondering if there is some way that we could use that desire that we all had to make sure the elders were protected, to use that same impetus toward the children who cannot be vaccinated at this time, and for who and who can be asymptomatic. We can carry it asymptomatically, the children can carry, we can pass it back and forth. I think a lot of people are getting the impression that, well, yes, it may just be like a cold for the children, but we do know that thankfully it's far less common than in adults, but there are some children who become critically ill and do not survive the virus. And so it's so imperative that we figure out ways to protect all of our children. And if you have any experience with that, if you know of programs other than the vaccine the mask mandates that are being implemented successfully, I might add, in those communities who are using them, they're documenting lower infection rates. And I think many of us are happy that we're not on school boards at this time. It must be so difficult, so painful and difficult for those people. Are there any other thoughts you have on ways we can protect the children?
I can comment. I wish I had a better answer, but I mean, what we know about children, first of all, to your point about, luckily, a lot of kids don't seem to get as sick, but it's a little different now than it was last year, because last year everything closed down and I think kids were home. And so there were fewer cases, and the kids that got sick didn't seem to get very sick. But now, as we see more cases, we're seeing, more kids that are getting more sick. So from 2 weeks ago to today, when we looked at the data this morning, pediatric hospitalizations have doubled for COVID in 2 weeks. And between yesterday and today, cases went up from like 30 to 60, which doesn't seem like a lot, but they're kids, they shouldn't be getting sick. So protecting kids is very important. And we hope that later in the week, we're going to find out that kids can start to get vaccinated. But in the meantime, what we do know is the best way to protect our children is for all the adults in their lives to be vaccinated. That's the most important thing. And then for the kids to really be diligent about wearing masks.
And that, of course, is a problem. I Lawrence is a city of about 100,000. And so we have, a few thousand high school students, and we have somewhere between 25 and 30,000 college students between Haskell and KU. And I see these groups around town all the time, sometimes like a dozen kids at the bagel shop or more kids elsewhere, and nobody's wearing a mask. It just boggles my mind. And of course, they're eligible to be vaccinated, half of the high schoolers and all of the college students. And so I have no idea if they're vaccinated and they're feeling protected, or they just are oblivious to the whole situation with the pandemic. Are there any other, oh, I see, it looks like there's some questions there. Oh, let me make sure here. Okay, one question is, the booster is a Pfizer, and what is the recommendation for folks who have received the Moderna vaccine?
That's a good question. Well, so as of now, there are no boosters that are recommended. So what's recommended now are third doses. So that's for like a very narrow slice of the population, people that are severely immunocompromised, sort of to the level of somebody that has an organ transplant. So most people for now have 2 shots. And when the booster is, we're not even sure how the booster is going to roll out. I know President Biden talked about the booster, but the FDA and the CDC haven't approved it. And we don't know exactly what we're hearing. Kind of rumors is that it's going to be people 65 and up and maybe healthcare workers, but we don't know. And Moderna is, I don't think it's too far behind in terms of the booster. So I think it would be rolled out, I assume Pfizer first, then Moderna. But what I've heard also is that the booster would be for people maybe 8 months after their second dose. So most of us are still, wouldn't even be in the range for a booster yet unless you got it 8 months ago. So that's not the greatest answer, but that's what I have.
Well, and we have a very interesting, potentially legal question in the chat box as well. And that's one of our participants has 2 siblings who are 14 and 16, and they in Kansas, and they would like to be vaccinated. But they apparently live with their father, who is an anti-vaxxer. So the question is, can these teenagers be vaccinated before the age of 18 without their parents' consent? And here's the phone to call the attorney. No.
Yeah, I was gonna say, I don't have a great answer. I mean, I think it sort of depends on the vaccination site. I've seen at some that they're more generous in terms of what kind of an adult can give consent. So I don't know if you are 18 already. I mean, that's possible. I don't want to give you that advice because I don't know all the ins and outs, but I'm really sorry. That's a really hard situation.
That really is. I guess one thing that comes to my mind is if these children are enrolled, I would call their tribal clinic if they have a tribal clinic and talk to those folks. That's probably where I would start in this case. And perhaps the family's already done that. And the other option obviously is if it's socially and physically possible to contact the other parent. And if that parent is willing to take the inter-family strife risk of allowing these children to get vaccinated, who of course would be protecting their unvaccinated father as well. So that's a really tough situation. Thank you for sharing that. And I hope that you find a good solution, Sydney. Anyone else have any questions? I can't see the chat box. All right, well, I can't believe this. Are we actually finishing early? We are. Do you have any questions for us? Which we don't know.
Hi, Dr. Droin. There was a comment that was placed by Rebecca, I believe, in the chat box.
Oh, thank you. I can't see the whole box, it seems.
Okay.
Would you care to ask it? if you can see it?
Well, sure. It says throughout the entire pandemic, I've been impressed with the leadership of tribes. They took it seriously from the beginning and took extraordinary measures to keep communities safe. For the leaders, seeing the statistics about how many of our communities are still unvaccinated, do you have any thoughts about how to increase those numbers? For example, President Biden recently did a vaccine mandate for federal staff and contractors. Are tribal leaders considering mandates, or the state of Kansas considering mandates? So, Dr. Garcia, do you have any?
I can start. Yeah, as of now, the state is not considering vaccine mandates. I know Governor Kelly 100% supports vaccination, but right now the strategy is not to mandate it, but to try to get consensus with people getting it.
Yeah.
And Dr. DeRoyne, do you have a feel with the tribes in Kansas? Has anyone suggested that may be a tribal mandate for tribal employees?
You know, I don't recall having heard anything about that yet. My sense, just from my tribe, my sense is that people were generally pretty pro-vaccine. Now I know that we haven't achieved 100%. So my sense is that because the tribe took it seriously, the employees, the council took it seriously, the employees took it seriously. So when I go there, I see social distancing and I see mask wearing at this point. So, and closures as necessary, as we've had recently. Yeah. Anybody else have any comments and would like to talk about how your tribe is addressing the issue of vaccines, mask wearing, children going to school? I mean, obviously there are some families who, even though the school is open, they may or may not, be socially distancing, and they may or may not be wearing masks. And some families are just opting to keep the children at home, which of course may be, continuing the difficulties that the parents have had for the last year and a half. So, any other questions? Any other answers? Then I think, thank you both so much for taking time to spend with us. Those slides are great, and we will be sharing them. As you mentioned, they're tough for a lot of people to digest, especially at first glance. And so I'm really looking forward to sharing them with Chairman Rod, for example, although I'm not sure he was here pretty much to the end. But I'm not sure at what, he had to leave for another meeting. So I'm not sure exactly what time that was. So I'm really anxious to share with our clinic up at the White Cloud Clinic as well. So, and I'm sure that my other colleagues will do the same. And I hope that we stay in touch so that we can continue sort of the mutual education and take advantage of the new grants. And take advantage of both the CDC, the KDHE, and the AAIP websites, and let people know about them where they can actually get solid information on which to make good decisions. So we appreciate it. And Ashley, I'm so delighted not to feel pressed for time, because there actually were several things that I was hoping to share earlier. And one of them, Tom, was actually to acknowledge our tribal leadership. The four tribes are served by the 3 clinics, and the tribes just did a fabulous job, as you've already noted. And we just really need to let them know that we truly appreciate that. And of course, we're all just sort of in limbo waiting for the booster situation to be taken care of, as well as when the children can be vaccinated. To get off COVID a bit, there were some things that I really wanted to say at the beginning. I was having some terrible technical difficulties this morning. And the first thing was to acknowledge Olivia Puamo, Olivia is I'm not sure how this came to be, but she fortunately has functioned as the chairperson of the Sunday Fun Day committee. And Sunday Fun Day normally precedes the Monday, Tuesday in-person conference. And she was able to produce a Sunday Fun Day in spite of social distancing, which turned out to be a drive-through Sunday Fun Day, which was still a very good success, even though it wasn't like the usual kind of, afternoon, evening community festival. So Olivia, thank you very much for you and the achievements of your committee. That was much appreciated. I also wanted to say that we need to tip our hats to Misty Slater. Misty was our Tribal Health Summit Planning Committee coordinator for about 6 years, and she is amazingly organized and is swift with technology. And she has a degree from Washburn in, surprise, public health education, and is very committed to that. And she needed to return to be full-time at her job with the American Heart Association as I think it's a community advocacy advisor. And she works in something like with 14 or 15 different states, helping them. Hello, Misty. Thank you for checking in to help them with their outreach and education issues. So we really appreciated your being our coordinator for that time. And when we are able to safely gather again, we will appropriately celebrate. Then I'd mentioned about the clinics. And then the other thing I wanted to mention was the sponsors. We have, and hopefully you've taken a look at them on the various slides. We have some wonderful sponsors: Sunflower Foundation, Southern Plains Tribal Health Board. They both have been with us, I know, at least since 2015, about the time that Misty joined us, actually. And we really appreciate them so much. There you go. Thank you, Tiffany. So I want to say one more thing about those of you who are waiting to see Miss Tandy spin her wheel for prizes, and that is about evaluations. So we have an evaluation form, and the way this works is that we want it to be anonymous. And so Southern Plains Tribal Health Board is going to be sending the participants an email in approximately a week or so. And I'm not sure, but I think that Yonavia Hawkins' name will be on the email. I haven't clarified that yet, but it definitely will be from Southern Plains Tribal Health Board. That will be the email link, SPTHB. And the way it works is that Southern Plains, when they receive the email evaluation back, they will separate the name of the participant from the answers, and they will tally all the answers, and then they will send the answers only back to the Tribal Health Summit Planning Committee. So it will be anonymous, and we really treasure those responses because they tell us what was important to you, what was helpful to you, what was not helpful to you. And there are 3 last questions, which is first, what you would like to hear more about, whether it's a particular medical condition or an education issue, an environmental issue, traditional medicine, whatever you would like the Tribal Health Summit Planning Committee to take on for the next time we have an opportunity to get together. And you know that we sorely hope that it's in person. The next question is, would you like to have a Tribal Health Summit more than once a year? And the final question is, would you be interested in monthly lunch and learns? So please fill out those evaluations. We have a special meeting where we get together and go over the evaluations. So they're not just a piece of paper. We really lean on them. So the last thing I want to say before the wheel of prizes is I want to acknowledge our current Tribal Health Summit coordinator, and that would be Tiffany Lewis. So Misty left about the end of December, And Tiffany came on, I'm thinking it was the end of February, and we were delighted that she was interested in working with us. She is the epitome of that saying, if you need something done, ask a busy woman, because she always has several projects underway, including her family. And we really appreciate that she's a quick learner. She has accomplished a lot in March, April, May, June, July, 6-7 months. And Tiffany, thank you so much for a job so well done. And with that, unless somebody else has another announcement, and of course, I want to thank the whole committee. I mean, it's been really tough this last month, converting a 2-day conference into a 5.5-hour conference. So thank you all for persevering. And I'm hoping that we'll actually see you in person next year. Otherwise, Tiffany and Tandy, the show is yours. Unless I forgot something.
Well, thank you, Dr. D. I am in charge of helping to distribute some wonderful door prizes. So hopefully you can see my screen. We had a list of those that have been off and on. Hopefully we have most of you on here today. And we have about 16 door prizes and some wonderful donations. So our first one, and this allows you to see the wheel spin as we go, hopefully here. Our first door prize, and I should also say, if you could, Olivia P. Whammo, when your name comes up, should you be selected on this door prize wheel, Olivia P. Whammo will be able to take your full name and maybe a cell phone number so that we can contact you after this to get this prize to you that you win. And you can private chat that to her in the chat box. If you just go to chat on your Zoom screen and go to her name specifically, you can chat that information. So I think we're ready to start. Our first prize today is an Amazon Fire tablet that is provided through some grant funds from the American Heart Association. And we actually have 3 or 4 of these tablets to give, but we're going to do one right off the bat here. So let's spin our wheel. Oh my goodness. Let's see. Thought I had it all ready to go and it wasn't quite. All right, we're going to spin. There we go. Adonica Hennessy.
Yay!
We have you as our first winner. Yay! Adonica, if you could private chat. Yay! Olivia, with your contact phone number so that we can get this to you.
Okay, great.
All right. We're ready to bet. Thanks for joining us today too. Okay, we're spinning again. This prize is for a Morning Light Kombucha 6-pack. Christina Simmons, you are our winner. Christina, are you still on with us today?
She's just down the hall from me, so I'll take it down there.
Wonderful. All right. Well, Morning Light Kombucha donated this 6-pack. It's Melinda, it's a native female-owned kombucha company in Hoyt, Kansas. So kind of exciting to have Christina win that Morning Light Kombucha 6-pack. All right. Our third prize is a mug from Haskell Indian Nations College. So we will spin that. And our Haskell mug goes to Sydney Purcell. And again, Sydney, if you're on, if you can private chat Olivia, your contact information. Prize number 4. Okay, so we had some of these Amazon Fire tablets. We also have a Bluetooth keyboard and case. So this is our 4th prize. Bluetooth keyboard and case. And it goes, its lucky winner is Nick Barton. Nick, you get in touch with Olivia. I think you know who Olivia is. All right, prize number 5. We have another Amazon Fire tablet. And as you might be noticing too, this wheel does allow you to win twice. So your name does drop off once you won. So this Amazon Fire tablet through the American Heart Association grant funds goes to Anna Boswell. Anna, you are our second Amazon Fire tablet winner. And Olivia, are you getting some of those chats okay? Or do I need to slow down?
Yes, I'm just waiting on if you can private message me your phone number. That way we can get this prize to you. So we'll make arrangements.
Thanks, Olivia. All right. Prize number 6 is a Haskell keychain. So we will spin now for prize number 6. Oh, Josh Compton receives the Haskell keychain. All right. As we're doing prizes, the next one is Morning Light Kombucha also donated a t-shirt. So this prize winner will need to chat us a size as well so that we can get you the best fit here. So that size as well as a way to contact you. So the Morning Light Kombucha t-shirt goes to our representative, Christina Haswood. Okay. Sorry, I'm making notes as we go too. All right, we've got another tablet now. We're ready for our third Amazon Fire tablet. So as we spin for that, be noticing that you can chat Olivia in the private chat. Chanel Griffin. Chanel, you are our winner for another Amazon Fire tablet. And I apologize if I'm mispronouncing names. Hopefully it's not a horrible mispronunciation too. So that was prize number 8. We're halfway through. All right, our next prize is a Haskell water bottle. The Haskell water bottle goes to Julia Soap. You will be our Haskell water bottle winner. Okay, next prize. Okay, so Indigenous Pink has a t-shirt that is from the American Indian Cancer Foundation. And that's our next prize. So this prize that we'll be spinning for now, an Indigenous Pink tee to support the American Indian Cancer Foundation. We will need a size for this one as well as you reach out in the chat there. So this is the Indigenous Pink tee. And the winner for that is Sheila Redman. All right, Sheila, if you will reach out to Olivia, but we need a t-shirt size as well. Okay, another Amazon Fire tablet. We have a couple more after this and then a couple big gift card prizes as well. So one more tablet now. This Amazon Fire tablet, Artis Finette. That is your prize. Okay. Prize number 12 is another one of the Bluetooth keyboards in case. The Bluetooth keyboard in case. Yes.
What was
Olivia.
the last for the Amazon Fire tablet? Whose name was that?
RT.
That was RT.
I know. I can spell it for you. I've got it.
Okay. Can you spell it?
Awesome.
Yeah, I'll put it in the chat.
So Artis on the wheel.
Oh, you want me to just tell you?
It was ARTES.
Right.
And then Vanette,
okay.
VANNET.
Thank you.
Yes.
So now
All
we're on
right, and I have
keyboard.
Yes, the Bluetooth keyboard in case. And I just spun for that, and that is Sierra Tubals. So congratulations to Sierra. All right. we're ready for one more Amazon Fire. Well, we'll have two. So this is the second to the last Amazon Fire tablet. And then we have a couple $50 gift cards. So we're getting to the big prizes now. As I spin, this is for an Amazon Fire tablet. And the winner is Paula Smith. Congratulations. Again, if you can chat your contact information to Olivia, private chat, that will help her and us get that information to you and get your prize to you. Okay, Walmart donated us two $50 gift cards. So we're going to spin right now for one of those. So this next prize is a $50 Walmart gift card. It goes to Donna Holstein. And again, I apologize if I'm saying this wrong. Donna, you are a $50 gift card winner. Congratulations. All right, our last Amazon Fire tablet. The last one of those that we have as a door prize. Melvin Lewis. Melvin, congratulations. These again were provided through some American Heart Association grant funds. So we thank them very much for their sponsorship and all their support for this work. Okay, I know I'm going fast. Apologize. I know the prizes are fun, but you also have other things to do today. We're ready for our last prize. Olivia, are you ready for the last one?
Yes, I'm still needing phone numbers from Donna Holstein, Sierra Two Bowls.
Okay. Wonderful. If you can reach out to Olivia for your contact information, please. So our last prize of the day, our $50 Walmart gift card, our last one of those. And the winner is Jeannie Combs. You are our winner. Yay. Congratulations and thank you to everyone who was able to stay on with us and throughout the day. Back to you, Dr. DeRoyne.
Yes, well, I think, does anyone else have any other announcements that they would like to make before we close? In which case we will just once again say thank you so much for spending the day with us today. We're anxious to hear what was helpful to you and what you would like more of. And we want to send you on a safe way, wishing you a beautiful first day of autumn today, however you're going to celebrate that. And we look forward to seeing you in the near future. Be safe.
Okay.